Yes. Good morning, and welcome to the third edition of the Climate Change and Air Pollution Patient Conference. My name is Ulrike Gering. I'm an associate professor at Utrecht University in the Netherlands and the chair of the Environment and Health Committee of the European Respiratory Society. I'm sharing the event together with Phil Taverner, and Barbara Hoffmann will take over my position as co-chair in the afternoon. We have an international audience, and before we begin, a quick note about translation. We have live interpretation available today. To exit it, please look at the bottom of your Zoom screen and click on the interpretation icon. It looks like a small globe. Once you click that, you'll see the list of available languages. Simply select the language you'd like to listen in. If you prefer to hear only the interpreted audio, you can select Mute Original Audio. If you'd like to hear some of the original speaker in the background, you can leave that unchecked. If you're joining from a tablet or phone, tap the three dots, More, and then you should see a language interpretation option there. If you have any technical issues, please pop a message in the chat and our team will help you. So this is the third time we've brought everyone together for a patient conference on climate change and air pollution. It's clearly a topic that really matters to people. Today, we are going to narrow the focus and talk specifically about indoor air pollution, the air that we breathe in our homes, schools, and workplaces. It's easy to think of air pollution as something outside, traffic, smog, city skylines, but actually many of us spend most of their time indoors. And the quality of that air has huge impact on our health. Air pollution remains the biggest environmental risk to health. It's linked to asthma and pneumonia in both children and adults, COPD and lung cancer, cardiovascular diseases, and stroke. We are also seeing growing evidence connecting it to type 2 diabetes, dementia, and even mental health. So today is about understanding what indoor air pollution means for patients, families, and communities, and what we can do about it. We'll continue to explore other aspects of climate change and air quality in future events, because this is a broad and important area. But for now, I'm delighted to hand over to my co-chair.
Thanks, Ulrika. Hello, everybody, and a warm welcome from me as well, although it's extremely cold where I am at the moment in the middle of the UK. My name's Phil, and I'm delighted to join you today alongside Ulrika and Barbara in the afternoon. Just a word about me. I've lived with asthma for about 65 years now. I was diagnosed as a child and kind of been controlled most of that time. But one of the biggest triggers for me is air pollution. So that's my particular interest in this topic. So we're here to kind of continue the climate change and air pollution series, as Ulrika has said. We know this has an enormous impact on our lung health and is a very important topic for patients. And we want you all to feel inspired, informed, and empowered. I'm just going to say a little about the agenda for the day. So we've got 8 presentations. As mentioned, I'll chair the morning session along with Ulrika, and then Barbara Hoffmann, who's the Advocacy Council Chair for the ERS, the European Respiratory Society, will join us for the afternoon. Our job is to introduce the speakers, keep track of time, coordinate questions to ask at the end of each session. There's time allocated for questions after each session. If you put your questions in the Q&A box at the bottom, please, we'll be able to see it as we go along. But also we'll be able to kind of keep the questions so that if there's any questions we don't get around to answering during today's event, we'll be able to get back to you afterwards with some sort of answer to your question. So we're going to start with our opening session by Agnes Butz on exposome, its definition and how it impacts us. Then we're going to hear from Dr. Errol Guillard with an overview of moulds and moistures in the context of climate change and how they impact us. And after that, we're going to have our first patient testimony from Pirko Moisio, who's going to highlight her own experience with indoor moulds and related symptoms. Then we're going to go on to hear from Aidan Farrow, who will present the effects that gas has within our homes, referring to a recent Greenpeace study on the topic. Then we have another patient, Caroline Love, who's going to talk about her personal experience with esophageal atresia, tracheoesophageal fistula, and chronic respiratory disease. We're going to stop for 40 minutes for lunch, although for us in the UK, it's probably more like a long coffee break. It's a bit early for lunch, but hey, we're going to stop for 40 minutes. And then the second session after lunch, Robin Gould's going to start off. Dr. Robin Gould will talk about symptom mitigation and how patients can communicate with their consultants and vice versa. Then Anna Dorogoska will talk about how solid fuel pollutes our homes. And then finally, we're going to move on to how policy can improve our health at home with a presentation by the European Public Health Association. That's just a run through of the day's events. Ulrika, back to you.
Thank you, Phil. And I know we are all keen to get started, but I have a few more housekeeping messages for you. So the chat and Q&A, we encourage you to engage and be interactive in the chat. You can say hello and tell us who you are and where you're from. In case of any questions, please put these into the Q&A box. You also have the option of asking questions anonymously by clicking on the box at the bottom of the Q&A window. And just for the record, there are no stupid questions. There is a team of people who will be answering as many questions as they can throughout the day. Please keep in mind, though, that we cannot answer questions about anyone's personal circumstances or case. Please like the questions in the Q&A that you most want to be answered by using the thumbs up icon. This will flag them up for attention and may help to avoid duplication of questions. This is a webinar style event, so attendees can only see the speakers and chairs and hosts. We can't see all of you, so don't worry about appearance. Also, participants are muted. We can't hear you, but you can participate and chat and through the Q&A, and we invite you to do so. If you are on social media, do post about the event and share your thoughts. Please tag the European Lung Foundation, ELF, in your posts, and you can use the hashtag BreatheCleanAir2026. This event is recorded and talks will be made available on the ELF YouTube channel and the ERS respiratory channel after the event. So you and others can freely access them after the event. We will send you the links. Polling. There will be several polls that we will be asking you to participate in. And well, I just want to try one with you now. So this is an example of a poll. Breathe clean air, the entry poll. What do you know? Please tick the answers that apply to you.
I'm just letting it go for a bit longer because I can see a few more people are still going to answer it.
And you have about 30 seconds to answer the polls. And Catherine, can you give me a sign once you close this one and let us know whether everything is working?
It's working well and lots of people are answering. So I just want to give people a little bit longer to continue answering. As soon as it slows down, I'll share it.
Okay.
I'll share the results.
So these are the answers to the first question. So it's good to see that quite a number of people already know quite a bit about the topic, and actually almost 30% now say that they know a lot. This is good. This is a good base. But I hope also for those who already know a lot that this will be a very informative event where you will learn new things about the topic. And then there are, okay, so this is it. So that means we can now start the actual event and go to our first speaker. It's my pleasure to introduce the first session speaker, Agnes Boots. Agnes is an associate professor of respiratory toxicology at Maastricht University in the Netherlands, and the chair of the European Respiratory Society Clinical Research Collaboration, explain it. And this collaboration investigates the role of the exposome on respiratory health. Exposome is a word that we are hearing more often in the lung health community, but what it actually is, well, and what we know about it, well, Agnes will tell you all about it. Agnes, the floor is yours.
Thank you so much, and thank you for the very kind introduction. Not sure if I can tell everything about it, but I will try to do my best in the time given. I'm going to share my slides, I hope. They're also nice, but not what I wanted to show. Here we go. There we go. So thank you again, Ulrike, for the very kind introduction and also for the invitation to talk here today at this Breathe Clean Air Patient Conference. And it's my pleasure to kick off this morning session and to introduce to you what is the exposome, what are we actually talking about. The exposome, what we mean with the exposome is actually the totality of environmental exposures on individual experiences from conception onwards. So in other words, it's all of the environmental exposures that you encounter throughout your whole life. And together with the human genetic makeup, so also the genes that you're carrying and that you got from your parents, the exposome determines your health, but also your disease and your susceptibility towards the disease. The exposome covers, as you can see on this slide, I'm going to click this away so that might be easier. The exposome, as you can see on this slide, covers both the internal as well as the external environment. If we move on to the internal environment, which is depicted over here, we see that these are mainly biological responses towards triggers, for instance, your hormones or your metabolism. The general external environmental factors, which are depicted here below, consist, for instance, of exposures that will be due to traffic or to living in a big city or in the urban environments, but also due to climate changes. And then the last part, which is equally important, is the specific external or the personal external environment, which consists, for instance, of exposure to tobacco smoke, physical exercise, yes or no, and consuming specific products. What makes the exposome extra important is the fact that it covers lifelong exposure. So it can increase or induce a risk of a disease many years after you were initially exposed to it or after the exposure started, which makes it very important, but also very challenging to investigate. Additionally, even though the exposome is non-genetic, it does interact with your genes. And that means that some people might be more susceptible towards the adverse effects of the exposome than others. And that altogether makes it very important to study the exposure history from individual people. We want to use that exposure history, for instance, for early detection of possible exposure-related diseases. What can we find early on based on exposure that people have experienced, and can that give us a link to what disease they might develop later on? Closely related to that, obviously, is that we want to use the exposome to prevent diseases that are related to exposures. And if you take that one step further even, ideally, you would like to use it to prevent risk factors. If we know what is driving or maybe causing a disease and we know where you're exposed to it, then obviously it would be very tempting to suggest that if we can minimize that exposure, you will have less risk of developing the disease. A very specific part of the exposome is the so-called airborne exposome, which is basically the same as the normal exposome. So it's everything that you encounter throughout life and that you're exposed to, but then only the airborne part. So only the part that you actually breathe in. This airborne exposome consists of several different factors, all depicted here above in this slide. And it includes, for instance, the biological exposures, including bacteria, viruses, and fungi, and also the mold that will be addressed by the next speaker. Another aspect of the airborne exposome are the hidden chemical pollutants, including volatile organic compounds, but also microplastics, this is short for microplastics, and gases, which is also a topic of one of the speakers later in this morning. The part of the airborne exposome that I will briefly touch upon today, this morning, will be the criteria air pollutants. The criteria air pollutants represent a fraction of the airborne exposome on which most research has been focused until now, because they are mostly associated with adverse health effects, and they also are mostly regulated by law. And actually, by mostly regulated, I mean those are the only ones that actually have some regulation in law. For the rest, it's even less known and less sure. One of the main important air pollutants here, which is no surprise, and I think you all know it, are the PMs, and that is short for particulate matter. Particulate matter derives from multiple sources, as is depicted over here below in this slide. For instance, that could be industrial exhaust, but also the exhaust from normal traffic or agricultural exhaust, as well as natural or climate-induced disasters such as forest fires. The relevance of this PM, and especially also of the air pollution, I think, is underlined by a statement made by the World Health Organization in 2022 report that showed that in 99% of the 99% of the world population lives in a place where the air quality guidelines are not met. So it's a huge problem for almost everybody nowadays. The measuring of particulate matter is very complex and difficult to perform, because there's no such thing as one particulate matter. Every PM is different depending on where it's formed and how quickly it reaches the person that is exposed to it. What is very general for PM is that the carbon core, the element, sort of the inside of the particulate matter shown over here, is always a carbon core. But then what will change dramatically depending on where it is formed is the outer shell. The outer shell very often consists of liquid or organic compounds, but as I said, what is exactly on the shell is very different. It picks up whatever it meets on the way, I would say. So everything can adhere to the PM, which makes it kind of a Trojan horse almost. It takes everything with it that it's exposed to along the way. Examples of what all can be on the outer shell of a PM are depicted over here. On the lower left, you see soot, but also metals, fibers, or allergens. So also people that are asthmatic, but also have a lot of allergies, they will have extra trouble when exposed to particulate matter in the allergy season, because the allergens will travel along with the PM. So as I already said a little bit, is that the chemical composition of PM vary tremendously depending on where they are formed. Are you exposed to them very close to where they are formed? They will be pretty pure. They did not pick up anything yet from the atmosphere, but while traveling through the atmosphere, they will pick up different compounds that will adhere to them, and they will also take them along with them. And then obviously also the day and the time when they are formed is very relevant. So the season, the climate, whether there's wind, whether it's humid outside or not, that all affects what can adhere and what can then be taken along when you inhale them. Because that is the biggest threat, basically, of particulate matter, is that you will inhale them. So what is less difficult to know or to understand about PM is the categories they are divided upon. And I'm very quickly going to show that, just so that it's easier for you to understand what people are talking about when they talk about PM. So regardless of what is on the core, what is on the shell, what is on the outside of the PM, we still can categorize them only based on their size. So what you can see here in a very nice figure from the Environmental Protection Agency is in the mid is a human hair, as well as a fine grain of beach sand, just for your own reference. They are, of course, pretty small, but in this figure, they already appear pretty large. Yet, all the PMs, so the particulate matter with the different sizes, are way smaller than one human hair or one fine grain of beach sand. So over here, we have the PM10, meaning that their diameter is less than 10 microns. So they fit at least 5, 6 of them in the diameter of one human hair. And this is the largest category of the PMs that we have. And this is also the only category that might be visible with the human eye, but then only if it's produced in large amounts. So for instance, when you see smog or when you see the exhaust of cars, that would be a PM10. Even smaller is the PM2.5. That obviously fits in 4 times the PM10 because it's just simple math. And then we continue to the ultrafine ones, which are extremely small, definitely invisible for the eye, smaller than 0.1 micrometer in the diameter. This division in the categories is very important, and that's why I'm showing it to you, because it determines which part of the lung can be reached by the particulate matter, and thus also what kind of damage this specific PM can cause. And how that works is depicted in this figure, where you see the different PMs, as I just explained. So PM10 on the left, PM2.5, so the little smaller one in the mid, and then the PM0.1 on the right. The PM10 is also referred to as a coarse particle, which can only reach the upper, well, only, but it reaches the upper respiratory tract, and the body will try to fight it by producing mucus and then allowing you to cough, and then hopefully you will cough it out together with the mucus. In the mid part, you see the PM2.5, which is already smaller, so we call it a fine particle, which is already capable of reaching the lower respiratory tract. And in that lower respiratory tract, your immune system will try to fight it. Then the last category, the PM0.1, we call them the ultrafine particles. And they can reach the entire body via the blood, and they are very, very difficult for the human body to fight. So I hope that this figure explains that even though, of course, it's very dangerous to be exposed to any of the PM, that especially the small particles are the ones that we should fear and that we should try to avoid, because they are the most hazardous for our health. Most studies, whenever they look into the effect of PMs to respiratory health, are focusing not only on the PM0.1, even though we just said that this is the most tricky one for our health, but they very often include the PM2.5 as well, because most regulation until now has been done on this one. And what is a little bit confusing maybe for these PMs is that if we call it a fine particle, then we mean it is everything that has a diameter of 2.5 microns or lower, meaning that the PM0.1 is actually also covered if you measure PM2.5 because it is smaller. So if you measure this one, automatically this fraction is in as well. And I'm emphasizing that because the few studies I'm going to show you in a bit on PM exposures all have measured PM2.5, but that then also includes the PM0.1, but it's very difficult to make that distinction in large measurements. One of the studies who has looked into the exposure to PM2.5 is this one that's already almost, well, it's over 10 years ago, but it's still one of the most important ones because it has been one of the biggest studies. It included 20 population groups in 13 countries, having over 350,000 participants in. They have measured PM2.5, as you can see here in the color code, where the color green is showing the pollution of less than 5 microgram, whereas the color purple is the highest pollution, and that's over here in this part of Europe, and that is over 30 microgram. What has been shown by this study is that there's an increased risk of mortality for exposures to all air pollutants, and that there was even a significant raise in mortality, meaning that it really was, it was not a coincidence, but it's statistically significant. So it must be related to the exposure of the fine particles, meaning that the exposure to PM2.5 in any level above 15 microgram per cubic meter was significantly associated with an increased risk of mortality. underlining the impact of being exposed to this specific PM over a longer period. And why this is of extra importance, I think, this finding, is that this threshold of 15 microgram is unfortunately not the legal threshold. The European Commission of Air Quality has set the standard to the upper limit to be exposed to PM2.5 to 25 microgram instead of that 15 microgram that was shown to drop the risk of increased mortality risk, indicating that it might not be as safe as we now still consider. Obviously, this is just one study, even though it was a huge study with a lot of participants, and it's also very general. And it's only outdoor. So I also took one study which measured specifically on different hotspots within one city in Central Europe. This city was Düsseldorf, Germany, where the air pollution was, and 3 specific locations. Those locations are shown over, and what the researchers tried to find is a relation to the exposure to traffic, so road traffic, so in the city center, river traffic, obviously alongside the river, and air traffic from the airport. It was measured with a van that traveled through all those areas. It was compared to a low emission zone where there's almost no exposure to PMs. And then what is important and maybe a little bit different, difficult to explain, is that instead of measuring the PM exposure, these researchers decided to already link it to the lungs. So what they have measured, and you can see that over here, is the exposure by using the marker LDSA. LDSA stands for lung deposited surface area, which is also still very complicated, I think, and a mouthful. But actually what it means, and I put it down below, I hope that my marker works. I put it here down below. So it's actually the surface of the lungs that is reached by the particles. So it is measuring the exposure to PMs, and very specific PM2.5, but instead of giving the amount of PMs, they already give that as the surface of the lungs where the particles are traveling to, and that of course can then be used as a marker of potential lung damage. So for sake of time, I'm only very shortly going to go into the main result of this study, and that is this striking finding. I understand it's a big table, but there are only 2 things important, and I will highlight them. So I will take you through this. And that is that near the 3 hotspot pollution areas, so the airport, so the planes, the boats, and then the cars, what they saw there is that there was an increase of almost 20%, well, from 14 till 20% increase in that lung marker of particle deposition in your lung, meaning that almost 20% more particles actually reach the lungs and the part where they can damage the lungs and cause adverse health effects. And I don't think it will be a surprise that this increase in deposition in the lung was accompanied by also an increase of the actual PM2.5s. They were measured because they were related to that lung damage, but they are not one-to-one related to it. So you see that it's not only the PM2.5s that you are exposed to that will give more risk in your lungs, but for sure it's a huge factor. But this then, of course, means that you're very close to the source of the PM production, because they measured the PM exposures very closely to the sources, so on the different hotspots within the city. What would happen if you do not measure that close to the exact source? Another study has done that, and they have compared the outdoor versus the indoor PM exposure to get more information on what is actually happening with those PMs that are formed outside. Do we have to worry about them inside, yes or no? And what the researchers in this study have done is they have looked at offices in 4 different global cities, namely Tampere, Helsinki, Prague, and again, the city of Düsseldorf. And this graph shows the influence of both outside and inside air on, again, that marker of the position of the particles in your lungs. So it shows how the outdoor and indoor air affects the amount of particles that can actually reach the parts of your lung that can cause damage. Outdoor air is depicted in the red line, whereas the indoor air is depicted in the blue line. And obviously, if there's nothing there, if there's no line, then it means the measurements at that specific moment did not go very well. The lowest correlation between, or maybe I should start with the highest concentration, the strongest relation between the outdoor exposure and the indoor exposure was observed in Prague. And that was, oh, I'm sorry, I have to move forward first. I'm so sorry for that. So what I wanted to show with this one, I'm so sorry, I already clicked one slide further. What I want to show here is that obviously the indoor air is following the line of the outdoor air. It's lower in all of the cities, so it's not the exact same exposure, but strikingly the exposure very clearly relates to what is happening outdoor. So the outdoor PM exposure is affecting largely the quality of air inside. Then, and this is the slide I was talking to and I already thought I clicked, they also looked into the correlation between outdoor and indoor, and they did that by putting that marker of the outdoor marker here on the x-axis and the indoor marker on the y-axis. And then the correlation is depicted by a line. If the line would be straight up, it would be that every value here would be exactly that value there, meaning that the outdoor exposure is one-to-one related to the indoor exposure, which is luckily not the case. So that's a good sign. We do see that this one from Prague is pretty close to 1. It's a 0.8. You can totally forget that number, but the line is pretty steep, especially if you compare them to these lines. And that is because these offices turned out to have no mechanical ventilation whatsoever. So the outside air, almost one-to-one, is the inside air, giving a huge risk of exposure for all the employees in those offices. Strikingly, in these two cities, Tampere and Helsinki, where the correlations were pretty low, which means that the outdoor exposure is not resulting in a one-to-one indoor exposure, these two cities actually had mechanical ventilation with also a filter that supplies air, meaning that there's actually fresh air that is filtered in these offices, and then there's far less exposure, and the exposure is not one-to-one related to what you see is formed outdoors. But there still is exposure indoors, meaning that there are also a lot of sources of indoor PM exposure. A few of them are listed in this slide, and I'm not going to go through them for sake of time. And by no means is this list complete. I think nowadays people are still finding out more sources indoor that actually create a significant amounts of PMs that people are exposed to and that people are suffering from, especially if they're already a patient with respiratory diseases. And a few of them that are already really well studied are burning candles, frying sausages, also toasting bread. But you can imagine it's rather difficult to test these things in real life, because obviously we cannot ask a very vulnerable person or a patient to just stand above a barbecue and then inhale the air of the frying sausages. So we have to come up, we as researchers have to come up with other ways to measure how these indoor PM sources are actually affecting our lungs. And if we want to do that, then we have to do it either in the lab, so we have to mimic what happens in real life, or we have to use data from the past, so-called retrospective data, to see what was the exposure there, and then what was the effect, which is of course always an association. I mean, you can never say for sure that that is really directly correlated. So in short, if you want to measure the health effects of the exposome, a lot of researchers use the so-called cohorts, which are depicted here on the left. Cohorts are large groups of patients that all have something in common. So for instance, they're all suffering from asthma or from COPD, but obviously there are also a lot of things different within these patients or people. And that could be, for instance, the lifetime exposure. So by looking back in what people were exposed to and then what they are suffering from now. Researchers try to connect that and try to say, okay, this exposure might lead to this subtype of the disease or might lead to this specific extra symptom in the disease, and they're trying to make the connection there. Obviously, we do not only want to make the connection, but ideally we also want to make sure that we understand it mechanistically. And if we want to do that mechanistically, what we need are cells from those patients. So whenever patients are diagnosed with a lung disease, very often a lung biopsy is taken in which we find cells from your lungs, and we can use those cells then in the lab to expose them to specific pollutants, or for instance, to the PMs that I was just talking about. And we use those cells, but what we can also actually do is we can use those cells to create a mini lung in a dish. So it's a tiny lung in a Petri dish, basically, and which is called a lung on a chip. For that, we use this machine, and this machine, we just bought that with our group in Maastricht in the Netherlands. And we use this to expose those cells to real-life exposome mixtures. Cells will be on the right side of the machine, the cells or those mini lungs, and we then expose them. You can see that here, for instance, but we can do it on different sides. We expose them to real-life pollutants. So, for instance, directly the air from the street outside, or the diesel exhaust from an engine that is actually running in the lab next door. We also have it set up with wood, with burning wood, so with to get the smoke from burning wood, and then that's directly transferred to the cells. We can adjust the details of the exposure, so we can have the air being more humid or less humid or a higher flow rate to mimic conditions in real life from the climate. And then afterwards, we measure endpoints in those cells that are related to the disease, of which we know that are also taking place in the disease, and we're trying to connect the dots there. And those dots are very difficult to connect within the health effects of the exposome, as a lot is still unknown. The machine I just showed is trying to touch upon the bottom tip of the iceberg, so the biological mechanisms, but everything in between is also still very much unknown. So the mixture model, so what happens if you are exposed to multiple pollutants? What happens if you do filter, or if you only half filter? Your individual genes also play a role. The country with the limitations on the law, all these aspects are highly important. And I think we're still just on the top of the iceberg, and we still have to dig or go a long way to find the answers. And one of the ways that we want to try to find the answers is by joining forces. And this is the very last part. The joining forces in exposome research, and that's why we created a clinical collaboration, which is called Explain It. The full name, the entitled name is a mouthful, so I'm not going to read it out loud. What is important is that we're using this collaboration to unite patients, clinicians, and researchers to investigate the influence of the airborne exposome, outdoor and indoor, on lung diseases. And we hope with that we can find enough exposome data in those cohorts, so in those large groups of patients, as well as in healthy people, because we want to compare, we want to see what the differences are and what makes a person more susceptible towards the exposure. And obviously, as I said, we also want to try to link it to what is happening mechanistically, because if we understand what the damage is that is actually occurring in the lung, it might be also easier to develop a drug or a therapy or anything that might intervene with that. And the ultimate goal is obviously to create disease awareness, but also to promote healthier living and to make policymakers aware of the impact that outdoor and indoor pollutants have on respiratory health. I added the website of our clinical collaboration. In case people are interested, please feel free to scan the QR code or to go to the website and send us a message. And I want to end with the message that we are highly, but we're very happy to have patient involvement also within this collaboration. I don't think we can do it without any input from the patients. That's also why I'm so happy to be a speaker today and to hopefully get interaction with patients. So we have a dedicated work group on patient involvement. The chairs are Helen Parks and Claire Williams. And at the moment, they are setting up patient focus groups to discuss what is already known, but also what is not known and what is needed regarding the exposome from a patient perspective. If you would like to get more information or if you want to get involved, then please contact us via the QR code that I'm showing on this slide. I think that your input and expertise matter the most in this research, and we can only fight the influence of the airborne exposome and lung diseases together. Thank you very much for your attention.
Thank you so much, Angus. A really interesting presentation. I certainly learned a lot during that. We've had a couple of questions, but we're going to have a question and answer session a bit later. So I hope you can hang around. And for the people who ask the questions, please be patient. We will try to get to them. We're a few minutes over time. So if we don't manage to answer all the questions, then we'll get back to you later, as I said. So now we're going to hear from Dr. Errol Gaillard. Dr. Gaillard is the current chair of the ERS Pediatric Asthma and Allergy Assembly, and he's co-chair of Explain It that we've just heard about. He's a pediatric respiratory and asthma consultant and clinical service lead at University Hospitals of Leicester NHS Trust in the UK, and as well as an associate professor at the University of Leicester. So Errol, it's over to you.
Thank you very much, Phil, and hello everybody from the UK. I'm looking at sharing my screen. Right, I hope you can see all of this. So I'm going to be giving you an overview about molds and moisture, dampness in the home and their impact on lung health. These are my disclosures, but none of these are really relevant to my presentation this morning. I like to start with take-home messages rather than leaving them at the end. So this is really the key points I will be trying to get across in the next 20 minutes. So floods now affect human homes all over Europe and worldwide. And the second point is really important, damp homes. And this is not just after floods, we'll come on to that. But damp homes alone affect the lungs. And damp homes then lead to indoor mold growth, and that increases asthma risk and makes existing asthma more severe. But
Errol, I'm really sorry to interrupt.
Can you use the presentation mode in PowerPoint for your slides?
That's what it looks like to me. I'm in. Is that better?
No.
Someone else may. No. Is there any particular? To me, it looks.
Do you want to reshare it, Errol? If you want to unshare and then reshare, maybe it will work this time. Sorry, I think it just is better if you can see the slides properly.
Okay, let me get out of this then, although let's see. Okay, love a bit of technical issues.
It wouldn't be an online event without it, would it? So it's
yeah.
perfect.
Right, what's this like?
Okay, and if you go to slideshow, which is on the top bar, and click that.
Top bar, slide control, show webinar.
Slideshow on the PowerPoint, it should be.
I can put it in full screen.
Otherwise, do you want me to share it, Errol? I'm happy to share it. I've got it here.
If it's no better like this.
Yeah, that's great. If you could just stop sharing and then I'll share your slides and then just let me know when to move on for each one.
Okie dokie, stop share then. I'm trying to figure out why this isn't working. But anyway, let's not hold up progress.
Here you go.
Okay, amazing. Let's move on to the next slide. We've been through here. So next slide. Okay, disclosures, we've been through those. Yeah, okay, cool. So, so we got to the fact that indoor mold increases asthma and makes it more severe, but we absolutely need more research to understand more precisely the mechanism how damp and mold causes lung disease, and we also need to identify vulnerable groups. Next slide. So the European Union is well aware of the risk that floods pose to human health, and they have produced this document, regularly updated in 2025, where they state that floods are now the most common and the most costly natural disaster in Europe. And we're not going to focus on costs, but really on the impact of health. And the floods are really due to climate change, and we'll come on to that why. But it is expected, and I think this is really worrying, that over the next decades, we are likely to see more floods in Europe, and this is true from around the world. So the European Union's objectives really are to reduce and to manage the risk to human health of these floods that are going to occur. Next slide. So just a little bit on floods. So Europe is the fastest warming continent currently. And this is some data from the Copernicus. This is the European Union's eye in the sky looking over our climate. And 2024 was the warmest year on record for Europe. And so storms were often very severe, flooding widespread, and claiming at least just over 300 lives. But more importantly, or as important, affecting hundreds of thousands of people whose homes got flooded. So this is an increasing and a massive problem. Next slide. But floods are not the only problem that cause damp and moldy homes. And so on the panel on the left, this is some data from the UK Met Office. This is data that started in the 1830s. And you can see that this is the rainfall between December and February recorded every year up to 2025. And the trend really is very clear. This is where we start in the 1800s. And then whilst there is a little bit of ups and downs, the trend is very clear. Winters are absolutely getting wetter. And in fact, this year, I feel it's been raining for the whole of 2026. And as we speak this morning, this is UK, there are 80 flood warnings in place, mostly in southwest England. So this is becoming a daily occurrence over the winter. So the rain is also heavier, and this is due to rising temperatures because the warmer air holds more water. So not only is it raining more, but the rain coming down is heavier, and it's doubling, in some places tripling the hourly rate of rainfall. And just below our bottom right is a graphic of the temperature, again from the Met Office, again showing how temperatures in the UK rise and how this runs in parallel with the increasing rainfall. Next slide. Yeah, this is another recent report from one of our major newspapers, end of January, talks about homes having to be abandoned because of the floods. But the most important message here is that UK winter rainfall is already now 20 years ahead of predictions. So this is really climate change potentially accelerating. And this should be really concerning to all of us. And I'm sure it is. That is why you are on this conference this morning. Next slide. So what happens is that this rainfall really overwhelms house defences. There's a couple of pictures of indoor mould. Right one, landlord today, and this stark warning that Britain is in the grip of a damp and mould crisis. This is from 2023. Important to note that social housing is particularly affected. And I'll come back to this throughout, is that this is really poor and underserved communities are affected the most. These are already people who are suffering most of the negative health effects generally, and they are also the ones most affected by damp and mouldy homes. And the reason is that they're often, they haven't got the money to upgrade their home and create the rain defenses needed. And they also haven't got the money to address the damp and the mold problems that occur effectively. And I have to say, it was a cost of living crisis that many across Europe and the world are aware of. People often haven't got the money to warm their homes in the winter, and this really accelerates the problem. Next slide. But this is not just a UK problem. It's just that being based in the UK, that data is just more at my fingertips. This is a report from Hamburg in northern Germany. They clearly have a mold and a rain problem as well. Next slide. This from Finland, a report from 2023. What is nice here, they have surveyed 15,000 homes. This is a very large number, and they found a moisture, a damp problem in 19% of Finnish homes. So I could put many more slides up, but I think you get the idea that this is really a worldwide and a European problem. Next slide. So I'm talking very briefly about the airway. Agnes has already mentioned it, just so that we're all on the same page, knowing what we're talking about. This is a picture on the human lung anatomy. And you can see the nose here, and rhinitis. I'm not going to talk much about this, is a big problem in damp and moldy homes. And then we're going down the airways, the trachea, and we end up in the airways. And the airways lead to the alveoli. This is the distal parts of the lung where gas exchange happens, and oxygen goes into the blood and CO2 goes the other way. Next slide. And of course, asthma is a major lung problem, the commonest chronic respiratory condition in humans. And on the right, just a picture so that we know what I mean. There is on the left side here, there is a normal airway. You can see a nice lumen. In the middle, you can see this is an asthmatic airway already narrowed. And this is what happens on the right when people experience an asthma attack. The airways are really narrowed. And damp and moldy homes help to create this problem of asthma and also of asthma attacks. Next slide. So this is a recent study of China showing how indoor dampness affects asthma, wheeze, and rhinitis. Back one slide, please. Yeah, okay, fine. Well, we've covered this, but I think the important part of this is that window condensation alone in the winter increases the risk of wheezing. And this is a questionnaire study, quite a large sample, around 2,000 patients. So window condensation is sufficient as a sign of dampness that increases wheezing. Next slide. This also from China, a much larger study. Nearly 40,000 people have been filling out questionnaires. This is from 8 cities, daycare centers, and this doesn't only affect children. This is adults and children living in the household. This study effectively identified that there were more colds in people living in homes with water leakage, mold odor, indoor mold, and again, this condensation on window panes. Next slide. So this is a study from northern Thailand looking at junior high school students that were in buildings with damp and mold, and again confirming that household dampness and indoor mold increases childhood respiratory infections. What is interesting is that wooden homes seemed to be better for health because there probably seems to be, or the thought was there was better ventilation. And so this actually will bring us on to building regulations later, because that is going to be really important to face the climate, rain and damp crisis. Next slide. So this is a study again from Sweden, and again dampness identified as a risk factor for wheeze, daytime breathlessness, and as alluded to, building type really appears to affect this damp and mold growth or condition. And what is interesting is that occupants of houses constructed during 1975 to 1985 appear to have more respiratory infections. So building regulations are really going to be important, and they will have to be very tightly monitored, and the effect on indoor condensation and mold needs to be studied to maximize indoor dryness. So research is needed to understand what causes damp and mold and what can be done to prevent it, and that needs to be implemented through building regulations. Next slide. So the UK government clearly has started to understand this problem and wants to address the health risks of damp and mold in the home. Next slide. And what they state, actually, this is a really nice summary, that damp and mold primarily affects the airways and the lungs. So this is clearly a problem for respiratory physicians. And they highlight that dampness alone increases the health risk. And the more serious the damp and mold problem and the longer it's left untreated, the worse the health impacts and risks are likely to be. And there is a risk of increased airway infections. We've heard this already, but this is a very nice summary. Next slide. So mold in the UK has really hit the headlines with the death of this young child, Awab Ishak, who died in a town near Manchester, Middle England, in 2020. And Dad had reported there was a mold problem, but the housing association didn't do anything about it. And Awab died in hospital, and his death was attributed to the mold that was left untreated in the home. And in fact, this has changed UK law, because since October 2025, social landlords have 14 days to address damp and mold hazards after receiving a tenant's complaint. And this is really important and a very important change in the law. Next slide. So, talking a little bit about indoor mold, this is the European Asthma and Allergy Association group. And they're very active in research and also very active in sharing information. They have done a big systematic review looking at all the literature, published this in 2025, and concluded that for mold exposure, there was a moderate certainty of new onset asthma. What this is saying is that we can be pretty sure that if you're living in a moldy environment and you're exposed to mold, that this will create asthma. Next slide. And this is a study from France, essentially confirming this finding. They looked at data from nearly 30,000 adults. Visible mold was reported by 1 in 5, so about 20%, very similar to that Finnish study and all other surveys we've seen. And the moldy area size was associated, so linked with a higher risk of asthma and also more asthma symptoms. Next slide. So we have done a study in children a few years ago, and we studied 186 children who were already known to be asthmatic. And what is really alarming about our data is that those children sensitized to fungi, so they were allergic, if you want, to fungi, they had worse lung function compared to other children with asthma who were non-sensitized to fungi. And these children also needed more oral steroids to control their disease, and they had much greater lung inflammation compared to children with asthma but non-sensitized. So this fungal sensitization is really important. Next slide. This is some data from our adult group. So when you live with this condition, fungal sensitization for a long time, we're not going through all of this in detail, but the y-axis here shows the level of lung function, and higher is better. And whilst there is a big spread of the data, there is this group here on the left, and they had the lowest lung function among the severe adult asthma group tested. And they were people that were sensitized to fungi. These other groups were less sensitized or non-sensitized to fungi, and then there is a healthy comparator group. So again, confirming that fungal sensitization really causes big problems and affects lung function. Next slide. And Okay, yeah, if you go back one slide, just really to show that they went to the homes and also collected samples from the home. And in those homes with higher mold exposure, people were more likely to be mold sensitized. So there is a direct link to mold in the home, to sensitization, and that's causing asthma. And if you have asthma, to really affect your lung function. Next slide. So I'm really pleased that we have been given £2 million by the Wellcome Trust to study the indoor environment more and to look at respiratory health, comparing this to the indoor environment. And you can see the co-applicants, and I'm very pleased that there's a good European group studying this. And we also have Lungs Europe and the European Lung Foundation involved in this. And I can already say that Catherine will be reaching out to everybody, and we would be really interested in your involvement to help us conduct the right study, answer the right questions that are useful to the public, and then to help us publicize the message across Europe, so that people are more aware of healthy homes, on what they can do to make their home better for their respiratory health. Nearly done. Next slide. So this is what we're going to be measuring. We're going to be measuring in the summer and in the winter, because the indoor environment is very different in the summer compared to the winter. I've highlighted that we will assess for damp and mold, and we will of course collect many other data points. Most of them, or many of them, Agnes has already alluded to. We're very interested in housing type, because this is going to influence housing policy for the future. We need to understand how the build needs to be to protect its inhabitants. We will be looking at heating type, socioeconomic status, household characteristics. Next slide. So what interventions and policies do we need to implement to mitigate against the impact of floods and damp? Next slide. So the priorities really are better flood defences, so that rivers don't burst their banks and that they don't flood the homes. But we also need to look at reducing indoor dampness and mould, and much of it results from increased rainfall. So we need to protect inhabitants better. And I think this is a key message I want to get across. We really need to reduce deprivation and socioeconomic inequalities with a greater purpose as climate change continues, because these are the populations that will be mostly affected by climate change, by more rain, by flooding, and by having mouldy and damp homes. Next slide. Right, in conclusion, I hope I've got across that extreme weather events involving rain and floods are increasing in frequency, and that damp and mouldy homes disproportionately affect poor households, and they affect respiratory health. They cause lung disease, and mitigation measures are absolutely key to go forward. Next slide. And this is just really to thank all the children and families who participate in our research. This is our funders, and thank you for listening.
Thank you very much, Errol, for this very interesting talk. As said earlier, we take all the questions after the next and last presentation of this session. And I see that the number of questions in the chat is increasing, and I would like to encourage you to ask more questions. Use the Q&A to ask your questions to all speakers. And now it's my pleasure to welcome our last speaker of this session, Pirkko Moisio. She will talk about indoor air pollution from the patient's perspective. Pirkko is an expert with the Finnish Lung Health Association, speaking from the perspective of someone who experiences symptoms from indoor air. And she hopes that everyone has clean air to breathe. Pirkko, the floor is yours.
Olen Pirkko Moisio, Oulusta, Suomesta ja olen Hengitysliiton kokemustoimija ja puhun sisäilmasta oireilevan näkökulmasta. Voin tällä hetkellä melko hyvin ja mun oireilu on lievää ja kuitenkin terveydentila vaikuttaa mun arkeen, sillä joudun edelleen huomioimaan ympäristötekijöitä ja tekemään valintoja, joilla ehkäisen oireiden pahenemista. Tänä päivänä yleensä oireet poistuvat suurilta osin huonosta sisäilmasta poistumalla. Mä huomasin ensimmäisen kerran homeen ja sisäilmaongelmien vaikuttavan mun terveydentilaan joskus tuossa yli 10 vuotta sitten työskennellessäni vakituisessa työpaikassa. Oireeni olivat moninaiset ja toistuvat ja niihin kuului silmä- ja iho-oireita, nenäverenvuotoja, flunssan kaltaisia oireita, äänen käheyttä, poskiontelon tulehduksia, keuhkoputken tulehduksia sekä päänsärkyä ja kuumetta. Tilanne vaikutti elämääni merkittävästi ja jouduin pitkään pohtimaan, mistä oireet johtuivat ja mitä tilanteelle olisi tehtävissä. Lopulta ymmärsin, ettei kyseisellä rakennukselle ollut mahdollista tehdä korjauksia eikä työnantajalla ollut tarjota myöskään vaihtoehtoista tilaa. Työtä ei myöskään voinut tehdä etänä, joten päädyin irtisanoutumaan ja etsimään kokonaan uuden suunnan mun elämälle ja työelämälle. Oireilu toi haasteita myös harrastuksiin, parisuhteeseen ja ystävyyssuhteisiin. Onneksi löysimme keinoja käsitellä tilannetta yhdessä ja selviytyä sen tuomista haasteista ja muutoksista. Myös minulle tärkeä harrastus, luonnossa liikkuminen, kärsi jossain määrin, sillä ulkohomeiden pitoisuuksien ollessa korkeimmillaan myös ulkona oleilu saattoi aiheuttaa oireita. Vaikka vointini on nykyisin parempi, altistuminen vaikuttaa minuun edelleen. Oireiden lievittämiseksi teen käytännön toimia, kuten poiston oireita aiheuttavasta tilasta, vaihdan vaatteet, peseydyn ja hakeudun ulos raittiiseen ilmaan aina kun mahdollista. Elämäntapani ovat muuttuneet pysyvästi. Käytän hajusteettomia tuotteita ja ihmissuhteissa korostuu avoin keskustelu oireista ja niiden vaikutuksista. Oireilu ei kuitenkaan hallitse elämääni, vaan on yksi elämäni osa-alue, joka välillä muistuttaa olemassaolostaan. Homeen lisäksi myös muut sisätiloihin liittyvät tekijät vaikuttavat terveyteeni. Erityisesti kemikaalit, hajusteet ja huono ilmanvaihto pahentavat oireita. Yksittäinen altistus ei välttämättä aiheuta voimakkaita oireita, mutta useat peräkkäiset altistukset lisäävät oireilua merkittävästi. Myös usean tekijän, kuten homeen, kemikaalien ja huonon ilmanvaihdon yhdistelmä, on selvästi pahempi kuin mikään niistä yksin. Asuinalueellani myös puun poltto kylminä talvikausina, kuten nyt, saattaa tuoda oireita, kun ihmiset lämmittävät kotejaan ja puuta ei polteta aina puhtaasti. Oireet eivät aina helpota heti altistuksen päätyttyä, vaan ne voivat kertautua päivä päivältä. Parhaimmillaan oireet ovat kuitenkin ohimeneviä ja helpottavat miltei heti tai muutamassa tunnissa tai vuorokaudessa. Toivoisin, että sisäilmaan ja oireiluun liittyvät asiat huomioitaisiin nykyistä paremmin sekä terveyspalveluissa että päätöksenteossa. Erityisen tärkeää olisi, että rakentamisessa ja remontoinnissa kiinnitettäisiin enemmän huomiota hyvän sisäilman laatuun sekä kosteuden ja homeongelmien ennaltaehkäisyyn. Ja että olemassa olevien rakennusten kuntoa arvioitaisiin ja ylläpidettäisiin asianmukaisesti terveyshaittojen välttämiseksi. Tärkeintä olisi, että ihmiset saisivat tarvittavaa apua ja tukea, jos sisäilmasta oireilu koskettaa heidän elämäänsä. Oireilu tulisi nähdä myös esteettömyyskysymyksenä. Lisäksi hajusteiden vaikutukset ihmisten terveydentilaan tulisi ottaa huomioon niin julkisissa kuin ihmisten kodeissakin ja palveluissa.
Thank you very much for sharing your personal experience, Pico. We now have a few minutes for a Q&A, and I see that there are many questions. I try to answer as many as possible. We may not be able to answer all of them. So I would also like to ask the speaker to have a look at the Q&A tab after this session and see whether they can still answer some of the questions. But let's start with the question. I saw a couple of related questions that are about ventilation behavior and also air purifiers and what people could do to improve air quality within their homes. And I know, I guess it's relevant to both the combustion particles that Agnes talked about and the mold problem that Errol talked about. Maybe we could start with Agnes. Can you say something about air purifiers and ventilation, and then Errol, you could add after that?
Yeah. Of course. I think ventilation, of course, is key. And I think also the patient testimony has shown that the fresh air, depending, of course, on what the sources are outside, that the fresh air is a great way to resolve symptoms and exposure. But it's also very important to realize that most of the PMs will travel indoors when you ventilate. So ventilation ideally is with a filter, but of course not, most of the homes are not equipped with having such a filter in. And then you do have the air purifiers, but then it depends on what kind of air purifier you use. Nowadays, a lot of air purifiers use ozone to purify air and to clear pollutants from the air. And ozone itself is a super pollutant, which is also known to cause damage to the lungs. So I think it has to be, it's a very tricky situation. I think it's very balanced and very personal, depending on what the exposures outside are, how well you can ventilate, whether or not you can use a correct filter, and what kind of purifier you use. I'm going to give it to Errol time-wise to add anything.
No, I think you summarized it nicely on the air purifiers. But sticking with the mold and the dampness, the problem is, so ventilation is good, but in the winter, of course, this brings in a lot of cold air. And there is a huge number of, people testimonies that they cannot simply afford to open the windows because it'll just simply completely cool down their home. And after that, they haven't got the money to heat up again. So this is really very difficult. The only way we can prevent indoor mold and dampness is by providing better protection to homes so that there is less, less incoming moisture or rain, etc. And this will be costly, but this is how this will have to be addressed.
Thank you. Shall I take the next one, Ulrika? There's a couple of questions about perfumes, fragrance, and animal dander. Pirka mentioned that at the end of her talk. One question is saying, is any consideration given to these allergens because the presence of dogs, for example, in public spaces, public transport, is inhibiting for some people? And somebody asked whether there are actually any regulations anywhere in Europe about controlling use of perfumes and fragrances. I don't know who'd like to answer that one.
Happy to have a go. So coming to fragrances, yes, they can be challenging to the airways, and some people have very sensitive airways, and they will react to strong smells and strong fragrances. There are no laws preventing this, but I guess you need to talk to your close environment to ensure that in your home, at least, you can control these. A quick word on dogs. So it's interesting. The dog situation is complicated. If you grow up in a home where the dog comes first and the child second, then the child is actually protected from asthma. However, if the child comes first and the dog comes second, then the asthma risk increases. And this would be a whole talk in itself. Clearly, in the environment, it's more difficult. So if you're very dog sensitive, then you may have to avoid homes where dogs live in. And certainly you shouldn't have a dog yourself, I would say. So that's me on perfumes and dogs. Agnes.
No, I totally agree. I just wanted to highlight that I think creating awareness and making people aware of that this might have such a huge impact. I think that is also key. One of the co-chairs from our CRC, Claire Williams, for instance, has told me that she has a lot of adverse effects on the perfume of other people. So I try to remember that whenever I meet her, I do not wear perfume. Sometimes I do forget, and I feel really bad the moment I see her, because then I realize, oh, I did put it on. But it is important to create the awareness, because until then, I've never even thought about it, even though I do work in the field and I should know better. So I think it's also part of creating awareness, talking to people about, okay, the small things that we can do to make a more clean indoor environment for people we work with on a daily basis.
Thank you. There are a few more questions that are about the importance of mold exposure for other diseases other than asthma, and also a question about specific types of mold that maybe pose a greater risk for patients. Is there anything that you could add to that, Errol?
Yeah, in terms of molds, it's mostly filamentous thermotolerant fungi, and I explain what this is. So there is millions of fungi, but only a very tiny number manages to survive in human body conditions. This is all about temperature and environment, and this is why they're called thermotolerant. So they can tolerate greater temperature variations, and they can be isolated from the human lung. These are things mostly called Aspergillus penicillium. I mean, this is all very technical. But so there is a small number, and these can be found in the homes, and they can affect the human body. They can live in the airways, and they can cause sensitization when inhaled. So there is definitely a certain type of fungi that is particularly bad for us. And we have shown this in the research that I've showed you, and also research by my adult colleagues over at Glenfield. It's these filamentous fungi and sensitization to those that really causes the worst lung disease. And there's a couple of questions that were in the chat. So there is no known link to damp and mold and lung cancer, but there is a strong link to pulmonary fibrosis, as somebody mentioned. This is hypersensitivity pneumonitis. It's through that process, again, sensitization to the fungus that causes that condition. So yes to one, uncertain to the other.
Thank you, Errol.
I think we probably need to move on from the questions now so that we keep to time. But before we do, I'd just like to ask Pirkko to kind of add a comment to close this session off in person rather than the video. So Pirkko.
Oh, this is exciting. What do I say here? So thank you very much for this opportunity to speak. So the fragrance questions, I also used to use very much fragrances, but now I'm fragrance free. So it's a question that many should think about.
Thank you. I just wanted to give you a chance to say anything just to close it off in case we hadn't kind of got what you were saying in the video. So thank you very much.
Thank you, Phil.
So let's move on then. We will answer the other questions that didn't get answered, as we said earlier, offline, if that's okay. We're going to move on to the impact of gas in our home, and I'd like to welcome our next speaker, Aidan Farrow, who is going to talk about it. Aidan is a senior scientist at the Greenpeace Research Laboratories based at the University of Exeter in the UK, and he helps to provide scientific advice and analytical support to Greenpeace. Aidan, over to you.
Thank you very much, and it's a real pleasure to be here. So, as Phil mentioned, I'm Aidan Farrow, and I work for Greenpeace in our international office, and my job involves supporting Greenpeace campaigns and campaigners around the world with a focus on air quality and air pollution. And today I want to talk a little bit about a project that I did with Greenpeace in Croatia and Hungary last year, looking at indoor air quality as a case study and a bit of storytelling about how we are exposed to air pollutants in our homes, and a possible thing that we can do to address that as well. So this was work which as I said, was conducted last year with colleagues from Greenpeace in Croatia and Greenpeace Hungary, and also through our collaboration at the University of Exeter in the UK. And the end result was a report released in English as well as in Croatian, as shown here, and in Hungary, with our real aim of talking to people who are affected by indoor air pollution coming from a specific source, which is using gas for cooking in Croatia and Hungary. And perhaps the rationale for our work at Greenpeace, most of you who've come across our organization before will probably expect Greenpeace to work a lot on climate and environmental issues. But there's such a clear link here between using gas, which is mostly methane, the climate effects of methane. It's a powerful climate forcing gas, causing rapid warming over short timescales. So it's really important that we understand the environmental impacts of gas and methane right now. But it also has this very close link to health effects. And so it's a very interesting area for Greenpeace to work, because we can have hopefully an immediate and positive impact on people's health, while also looking at that broader issue of climate and the global environment. The key message being gas is a fossil fuel, it contains methane, and we get the energy from it by burning things, or by burning the gas. Whenever you burn a gas, you produce air pollutants like nitrogen oxides, for example. And that's the process that I'm going to talk about today. We became interested in this topic after a few related pieces of work were published over the last 5 years or so. The image here on the left from an organization called CLASP, who looked at homes across Europe. I think they visited possibly 20 different countries across Europe, looked at particulate matter inside people's kitchens and inside their homes, looked at nitrogen dioxide, and they found that homes where they had gas cookers, there were worse nitrogen dioxide pollution levels in general compared to homes where they had electric cookers. One of the things they didn't do in that study was see whether the homes which had gas cookers could be improved simply by removing them. And we were interested, could taking out a gas cooker really change the environment significantly inside people's homes? So that's one of the motivations for our study, that question. The study on the other side with the blue background there is some work from the United States, where researchers have been looking at what's actually in the gas that comes into our homes that we're cooking on. We know there's methane in there, that's what we burn, but there are other pollutants as well, or other compounds in there as well. And they found that in samples taken from people's kitchens across North America, 97% of those samples had a compound in it called benzene, which is a known human carcinogen. And because nobody's cookers are perfectly sealed, a little bit of that is leaking out into the air all the time. And they were measuring concerning levels of benzene just in people's kitchens, even when the cookers weren't in use. So we've looked at these two pollutants, the nitrogen dioxide and the benzene, and been asking this question, could removing a gas cooker really improve environmental quality in people's homes with respect to those two pollutants? A little bit about the two pollutants. So nitrogen dioxide, with the white background there, the World Health Organization has some guidelines around it for annual levels, for 24-hour averages, and for short term for 1 hour, ranging from 10 to 200 micrograms per meter cubed. So it's recognized and known to have adverse health impacts, respiratory problems, asthma, and we know that children and people with some pre-existing health conditions are more at risk as well. And then looking at benzene, the World Health Organization doesn't have guidelines, or doesn't recognize a safe exposure to benzene. It simply is a risk factor for cancer. So some exposure carries a risk. Some countries around the world do have regulatory limits and things. They're all very, very low. But generally, we want to avoid exposure to this compound wherever possible. On to our experiment. We wanted to test a hypothesis. Could switching from a gas cooker to an electric cooker reduce indoor air pollution concentrations? Our null hypothesis was that if we went and tried to measure this, the switch from gas to electric cooking we wouldn't observe a measurable improvement in indoor air quality. And in order to do that, what we needed to do was design an experiment which controlled as many variables as possible. We recruited individuals and homes across Croatia and Hungary who were already planning to change their kitchen, to switch from a gas cooker to an electric cooker. And we asked them, can we measure the air quality in your kitchens before you make this change? Come back and measure it again after you make this change. So we followed the same homes with 2 different scenarios, using a gas cooker and then using an electric cooker. And the advantage here was, because we're following the same home, the home design doesn't change. The size of the kitchen, for example, the amount of ventilation. The people didn't change. The way they behaved, the amount of cooking they did, the food they were preparing didn't change. They had the same diets before and after. And because we were looking at homes through time, we weren't going to different places. The outdoor sources of air pollution, we heard this morning that outdoor air pollution is closely correlated to what is indoors, inside our homes as well. So our study was designed to try and control all of these factors. The homes, the people, the kitchens, the food, all remaining as similar as possible, with one change across the board, which was the removal of gas cooking and the installation of an electric cooker. And this is how it worked. We planned the study. Because we're asking people to make an intervention to change the way they're behaving, we went through an ethical approval process with the University of Exeter, and then we recruited our participants. We visited each participant and took samples in their homes for 2 weeks, a 2-week average of the quality of the air inside their kitchens while they were cooking on gas. We then gave each participant time to switch. So they chose their own cooker, they made their changes in their kitchen, and we came back for another 2-week period where we took another 2-week sample and compared the difference, went on to analyze our results. So that's how our experiment worked. We had 9 participating households in Croatia and 3 in Hungary, so it's quite a small sample. In order to be part of our study, all of the homes had to be cooking with gas from a piped supply, so not bottled gas. They had to be already planning to transition to electric cooking, and they had to be cooking most days, at least 4 days per week. They were using their cooker in the home. We also made sure that nobody was burning solid fuel, which I think is a topic we're going to hear about later on today. There were nobody smoking in the household, using incense or candles, and we avoided houses that were near to really busy roads or other industrial sources of air pollution outdoors as well. And our participants were then located in these towns and cities across Croatia and Hungary, ranging from Budapest in the north and the east through to Zagreb and Rijeka down on the Adriatic coast. And this is what the sampling looked like. We took samples inside people's homes, in their kitchens, but also outside as well. And that's so that we could account for how much air pollution might be entering the homes from outside, which was beyond the control of our participants. And what you can see here in these photos is one of my colleagues installing some see-through plastic sampling tubes which measure nitrogen dioxide. They've got a small amount of a compound inside them that reacts with any nitrogen dioxide in the air, and the progress of that reaction tells us what the concentration of nitrogen dioxide was during our sampling period. And the metal sampling tubes you can see there, they're packed full with carbon, like charcoal, and they absorb the volatile organic compounds in the air, compounds like benzene that I just mentioned. Gradually over time, any benzene in the air becomes trapped to that carbon inside the metal tube, and we can take those back to our laboratory, heat them up, release the benzene from them, and measure how much was in the sample using a mass spectrometer in our laboratory. Here's an image of some sample collection inside the kitchens. You can see this main photo here is an after photo. When we return to the home, the gas supply there has been closed off. and the electric hob has been installed, and we're taking a measurement about 1.5 meters away from where the cooking was taking place, and about the height that people in the room would be breathing the air. So we're trying to get this representative sample of the air people would be breathing in that kitchen. On to our results. We measured 6 different compounds, nitrogen dioxide and benzene that I already mentioned, and also 4 other volatile organic compounds which are associated with gas, but also other sources within our homes. So those were toluene, ethylbenzene, and 2 different types of xylene. And these graphs here show a grey bar for each household. That's the amount that we measured outdoors, and an orange bar for each household, and that's the amount that we measured indoors. And what you can see is a bit of variation. Let's have a look at the nitrogen dioxide. We've got some households with quite high concentrations of nitrogen dioxide, some are much lower, and in some cases there's more nitrogen dioxide outdoors, some cases there's more nitrogen dioxide indoors. We are now going to compare these results here with what we found for each household when we returned to the scenario when the electric cookers had replaced the gas. And you're going to see this mirror image plot here, where you can see, in the case of nitrogen dioxide, each of these bars is smaller. In the case of benzene, each of the bars is smaller. But for our other pollutants, it's a lot more complicated. You can also see that the outdoor concentrations of these pollutants changes as well as the indoor concentrations as well. But this first look at our results suggests perhaps there's an improvement in the nitrogen dioxide and the benzene inside people's homes. If we take the average across all of our houses, that's confirmed. So let's look at nitrogen dioxide again. We can see the orange bar here, indoor nitrogen dioxide was high to begin with across our households and dropped when people started using their electric cookers. The same with benzene. Actually, we see all of these pollutants that we measured have dropped from the before scenario with a gas cooker to the after scenario with the electric cooker. But what we also see is outdoors there are changes too. And that means we can't be sure that these improvements in air quality are just because the gas cooker was removed. It could be that there's some other factor. Perhaps the cleaner air outside is also improving the air inside the homes. And this is because indoor air quality is extremely complicated. We heard a little bit earlier today about all the different sources of air pollutants inside our homes. And these include not just cooking, which is what we looked at in this study, but also from heating, from our furniture, from chemicals like paints, cleaning products, and aerosols. And there's this exchange between the outside environment to the inside environment. So traffic pollution, for example, can enter our homes depending on how we ventilate. We needed to understand whether our hypothesis had been supported by the experiment. So we needed a way to control for this indoor to outdoor exchange of air pollution. And to do that, we used a simple model which looked at the rate of ventilation in each of our participants' homes, the concentrations outside and the concentrations inside, to try and estimate how much of the pollution we measured inside each kitchen was actually from a source inside the kitchen, and how much of the pollution we measured inside those kitchens was coming from somewhere else and was not related to the gas cooker. I'm going to show our results in a little more detail now, and I'm going to show a series of these plots which have a grey bar, again showing our outside measurement, and then an orange and red bar which shows the amount of pollution in orange which we think comes into the household from outside, and the amount of pollution in red, which is the amount of pollution indoors coming from a source inside the house. First of all, let's look at those volatile organic species. For ethylbenzene, toluene, xylene, in each case, we can see that the outdoor pollution concentrations fell, but there's a more complicated picture inside. And actually, our model is indicating that there isn't a significant change in how much of these pollutants was coming from inside the home during our experiment. We're concluding here that removing the gas cooker didn't cause a measurable improvement in these air pollutants. But if we focus instead on my initial two species, the ones which had the most clear-cut case around people's health and health impacts, we see the opposite. We can see a significant change in the amount of pollution indoors coming from a source indoors. So that's this red bar here, indoor sources of nitrogen dioxide reducing, indoor sources of benzene reducing. We tested this using a statistical test to see if across our range of different households, the conclusion was supported, and we found that for these two compounds, it was. To put that result in context, there are other studies that have done some similar things, not quite the same. On the left-hand side here is a graph from a study being run by Imperial College in London, where they've been taking detailed measurements of air quality inside people's homes in West London. And one of the households they've been following, the family moved house during the study, and they took their air pollution monitoring equipment with them. And you can see the first half of this graph here is characterized by lots and lots of black spikes, which show nitrogen dioxide spiking very high concentrations while the household were cooking using a gas cooker. The same people moved into a new household with an electric cooker, and all of these black spikes are no longer present. So it's another separate strand of evidence confirming that removing a gas cooker but keeping other things the same can genuinely improve the nitrogen dioxide air quality inside people's homes. A study on the right here is from the United States, where some researchers worked with a social housing provider to look at nitrogen dioxide when people change from gas to electric cooking, and their results show the same as our study, that when using gas to cook, there was elevated nitrogen dioxide. When using induction electric cookers, this was not the case. What we're doing here is adding the additional pollutant, the benzene, the cancer-causing compound to this study. So overall, we've shown that cooking and gas creates air pollution. We've seen that some of the pollutants we measured exceeded health guidelines and were concerning. And this is important because people spend a huge amount of time indoors. Up to 90% of our time is spent indoors. And our results are showing that switching from gas to electric cooking lowers nitrogen dioxide concentrations inside kitchens, lowers benzene concentrations inside kitchens, and provides healthier air to the participants. We found that when homes used electric cookers, the nitrogen dioxide and benzene was lower in all of the homes. And in some cases, we actually could no longer detect any benzene in the homes. And when we did that modeling step to try and isolate what was pollution coming from outside and what was pollution coming from inside, we found a 90% reduction on average across our homes for nitrogen dioxide, and that benzene was lower in 9 of the 12 homes that we studied. So the next steps, what are we thinking about now? Greenpeace are really keen to encourage authorities in Europe to move away from using gas because of its link to climate change, but also because of its link to people's health. We'd like countries to provide financial support to help people make this change, to prioritize the most vulnerable groups, whether they're low income or poorly vented and overcrowded homes, for example, or homes where there are people who are more vulnerable because of their pre-existing health conditions. We'd like legislation that prohibits new residential buildings from having gas stoves installed. And we'd also like people to think more about how to regulate indoor air quality. And perhaps the best way to do that is by enforcing emission standards. So making sure that the equipment we install in our homes isn't emitting some of these pollutants. Our view being the best way to do that is to move away from using fossil fuels and to move away from using gas. If you're interested in this sort of work, please do take a look at the Greenpeace Croatia website where you can read our report. So that's this greenpeace.hu/gas. You can learn more about Greenpeace and our work at our main website. And if you'd like to support our work around natural gas, fossil gas in Europe, we'll share a link to an open letter which people can sign, which is calling for a fair phase out of fossil gas in the European Union. Thanks very much.
Thank you very much, Aidan, for this very interesting talk. As said earlier, you can ask questions through the Q&A that we will take after our next speaker, or actually after the video that we have from our last speaker, Caroline Love, who will talk about her own experience. She was born with esophageal atresia and tracheoesophageal fistula, which is a rare anomaly that has left her with chronic respiratory disease. She works as a dermatologist in the UK and is a volunteer for Tufts and EAT patient support groups and is a patient group representative for the European Lung Foundation. So could we please see the video?
I'm Caroline Love. I'm a dermatologist and I was born with esophageal atresia where the esophagus is not fully formed at birth, as well as tracheoesophageal fistula. This has left me with tracheomalacia, so a floppy airway, and as a result of the anomaly, I have an asthma-like condition and bronchiectasis. I've had it since birth. Certainly, it was much more severe in my childhood and school days, probably up till about the age of 30 when I started getting some input. So I missed a lot of school, maybe around a third of my schooling and medical school from chronic respiratory infections. But also I have a very pronounced barking cough. With esophageal atresia, it was only first begun to be corrected in the 1940s. And the first big wave of sort of survivors was the 1970s when I was born. So there wasn't really anything known about the long-term respiratory issues when I was born, and we were regarded as fixed at birth. So I was kind of constantly at the doctors with my mum. And by the time I kind of left school and went to medical school, I just gave up trying, apart from going for the regular antibiotics that I needed. It wasn't until I was 30 when my work colleagues said, you know, you really need to see somebody about it. It was probably slightly less obvious in childhood because my chest was so rubbish. But certainly a lot of my family lived in council houses, old social housing, and they had the old bar gas fires, and those used to affect my chest. My family used to work for the cigarette factories, so they were quite heavy smokers because they got free cigarettes. So that poor air quality used to affect me. More recently, I think certainly when I was in my 20s, I started to cook a lot more, and working with the gas, working with the ingredients really affected me. For the first time, I started having proper asthma attacks. I always describe them as kind of napalm to my chest, that I don't have to be in the room with them very long. My chest will go off for another week or so, and I'll be incapacitated with the inflammation it triggers. I've had to leave meetings where there was wood-burning stoves, and friends and family who get wood burning stoves, I tend to take quite personally, because I know that really limits my ability to visit them, which I know it's not all about me, but particularly family members, it feels a little personal. I'm also affected by scented candles, perfumes. Again, at a meeting once, there was someone with a very strong perfume, and I started having sort of very strong asthmatic symptoms. Cleaning products will also affect me. At home, they'll affect me. I know that they're not good for you in confined spaces, but obviously the more confined or the more spray aerosol cleaners really aggravate my chest. And the same with hospitals. So if rooms have been what are called claw cleaned, so really disinfected from, if there's a contaminated room, then I really can't go in that room because I know that I just won't last there without being off work the next few days if I'm in there. For the next few days up to a week, I can be struggling to breathe. I can be coughing up more sputum. I can be generally less able to move around, breathe easily. I'll be coughing at night. And sometimes I'm not well enough to sort of do my day-to-day activities and go to work because of it. I suspect I'll just keep ticking along as I am, but you always want to function more than you are already. In an ideal world, there'd be a magic wand and I'd get to fit the criteria for some of the new biologic drugs, but unfortunately, I don't hit the thresholds for those drugs because I'm not specifically asthma-y enough, I think, so that limits my ability to optimize my treatment. I do have air conditioners and air filters in my bedroom, in the living room, well, in a couple of the bedrooms and living room, and that's a massive difference because that filters the air as well, and particularly in summer, that really improves the air quality from the outdoor wood burning and the like. I have an electric cooker. I mean, we don't have any scented products really in the home, but we have scented products that you can apply to you, but not aerosolized ones like spray perfumes, air fresheners, plug-in air fresheners. We don't have barbecues outside that can allow the air to come in. And I mean, like most homes these days, we don't have people smoking in it as well. So I think also I'm mindful of what I'm cooking so that I'm not, again, aerosolizing irritant chemicals into my airways. I think realistically, I've rearranged my life around minimizing that, but a lot of those things weren't things I did in any case because from birth, it was obvious probably to my parents that those things were aggravators. I work in person in the hospitals only 2 days a week, and the rest is working from home doing telemedicine. So that's really helped my airways, not just from the impact of chemicals in the hospitals, but really more from the strain on my airways of prolonged talking. Ideally, I think longer term, if my health deteriorates, I would go more to telemedicine even more than I already am. But then you lose the connection with colleagues. And certainly when I was quarantined through COVID, you find that there's different nuances to working with colleagues if you don't see them face to face. So I'd be reluctant to go fully telemedicine because you end up having emails where people think misreading what you're saying because they've never met you. I think life would have been easier socially and professionally and personally without all of this having a part of it as well. And it's taken, as I say, till my 30s to start to be able to notice the triggers. And so again, much of my health might have been improved by knowing those triggers earlier as well. There's been a lot of focus again on the effects of indoor smoking and smoking in general, obviously 100% bad thing. If I do come into contact with cigarettes, it's actually less impactful than vaping. So if I come into contact with the vape perfumes, that affects me more. I mean, from my point of view, indoor particulates from indoor fires in wood burning stoves needs to be much more carefully monitored, and indoor perfumes and candle burnings. I mean, everyone loves a scented candle, but they're still releasing chemicals into the air that children, dogs, cats, people in general are all affecting their lungs. And it's just an additive effect to the outdoor pollution and anything else that's affecting your airways.
Thank you, Caroline, for sharing this very personal experience with different sources of and different types of indoor air pollution. We now have time for a few questions, and I see that there are some questions in the chat. I want to kick off with a question to Aidan, combining several of the questions from the Q&A, and that's, well, I think there are several people asking to confirm whether electric cookers are indeed better than gas cookers. Whether the same applies for gas fires than for the gas cookers. And I think one question that I would personally be interested in is for those of us that are not able to switch immediately and can't wait for policy to take action. Is there anything that people can do to reduce the impact of indoor air pollution from gas cooking and other gas-fired appliances?
Thanks, Ulrika. So if I'll take those in reverse order. So yes, there are definitely things you can do to manage your indoor environment. And we heard a little bit about ventilation being this very important topic. As part of our work, we provide some resources to help people understand some steps they can take. So one of the links, I think we'll share them later, includes some simple steps around how to ventilate while you're cooking, whether you can use an electric extractor fan, open a window, or do that just for a potentially quite short period when you finish cooking, just to get the pollution that you've just generated out of your home. So there are some strategies you can take which can reduce that risk, definitely, without a big investment in a new cooker. Does this mean that electric cookers are better than gas cookers? Well, for the pollutants we looked at, our study says yes. It's saying if you stop burning this fuel, you're not going to produce nitrogen dioxide. If you don't burn gas, the actual process that produces nitrogen dioxide isn't happening. So you're going to remove that pollutant from your home. And for benzene, the gas, again, is the source of that pollutant. There are other indoor air pollutants associated with cooking. So you also need to think about the food you're cooking and the way you're cooking it. Frying something, for example, produces lots of particles. So just switching to an electric cooker doesn't mean that you've solved all of the indoor air pollution problems associated with cooking, but you can address those specific ones around nitrogen dioxide and benzene, or at least help address those ones. And I think the final question was on, do these findings apply to gas fires and gas heaters? And it's a similar answer. So if you're burning a fuel in air, you'll produce nitrogen dioxide. So if the gas heater is burning gas, it's going to produce at least one of the pollutants we looked at. The question is, where does that go? Does it go straight out through a chimney or a flue? Does it get outside of your home or not? And even if it does, it's still going to be polluting the environment that you're in. So I would encourage people to move away from burning gas because you are generating pollution. And sort of accepting that you need to balance against what you can afford to do in your personal situation and those things. But yes, some of those conclusions do carry straight over to any other place that you're burning gas.
Thank you.
Thanks, Aidan. We've got time for more questions, and there are some that are kind of related back to the earlier talk. So Ulrika, I suggest we kind of take some of those as well, because we've got a bit of time, and if the speakers are still with us, that is. There's one question about, should you have plants and flowers in your house? What about indoor plants? Anybody got any questions, ideas on that? Silence.
Yeah, I could. Is Errol here?
Yeah, Harold. Yeah, go ahead, Errol, please.
I can come back on this because, oddly enough, this question gets asked quite regularly. And there are indeed plants, different plants, oddly enough, do different things. So you can have indoor plants that may actually not help your indoor air pollution, but there are plants such as aloe vera, for example, that are meant to take formaldehyde out of your environment. So it is definitely worth looking into. And before you invest in plants, maybe have a little online search to see what plants are doing, but there are definitely plants that could help improve your indoor environment.
Thank you. Caroline, I see you have your hand up. Do you want to come on that?
Oh, yeah. I mean, all I wanted to add was certain more cut flowers than actual planted plants, but I do find heavily scented flowers such as lilies impossible to be in the room with, and they do exacerbate my airways. But I mean, most plants are fine, but certainly heavily fragrance ones are also irritant to me.
Okay, thank you. So get the advice of a horticulturalist before you have the plants in your house. See which ones you should have.
And maybe to add to that discussion, there's also a big discussion around the use of pesticides for flowers. So that may be a very different exposure, but that's definitely also something that's not good for your health, and that you may want to think about before you get flowers into your home.
That's a very good point, Ulrike, that I was going to make as well. Particularly imported red roses are full of toxins, and it depends on the cultivated flowers. But yes, obviously they're cultivated a long way away and they have to be transported. So many of them contain a lot of chemicals that you may not want in your home.
Well, do we have any other leftover questions?
There's a couple more. Yes. Well, somebody is asking, is there any evidence about
Aidan has a raised hand. Maybe if it is.
Sorry, yes, Aidan, go ahead.
Sorry, I didn't mean to interrupt. I was looking at the questions earlier in the chat and inadvertently answered one by text rather than by speaking. And I thought I'd just quickly mention that one, which related to my talk, which was around why was the NO2 and the benzene behaving differently to the other VOCs? And we think this is because the toluene, the xylene, and the ethylbenzene that we were measuring can come from sources other than the gas that we were looking at. So cleaning products, solvents, paints, these sorts of things can produce those pollutants. We think that that's why the change in gas cooker wasn't affecting those compounds in people's homes. But perhaps this ties up to the point that we were just hearing from Errol about other products in our homes that bring these other chemicals in, and thinking about maybe less obvious sources of indoor air pollutants. Thanks.
Thank you. So I picked up a couple of other questions that we could maybe pick up. Somebody asking, is there any evidence on vitamin D deficiency and protection from mold? Anybody has any answers to that question?
Not that I'm aware of. Vitamin D has been widely studied because it was supposed to help with asthma and other respiratory conditions, but the evidence is actually quite weak. And I think the only thing that will help with mold and the effects of mold on lung health is to eliminate the mold. Vitamin D isn't going to be of great help here.
Thank you. Yes, that's going to be an open question for a bit. And the last question I picked up that hasn't been, it's more of a comment than a question, was from somebody who used to be a swimming instructor and was diagnosed with bronchiectasis. And apparently that was caused by years of breathing the chlorine and the mold in the swimming pools, which she was doing her swimming pool instruction. So that's something we haven't addressed, but I wonder whether anybody got any comment on kind of indoor leisure pursuits like that.
Not a huge amount of data. If I come back in, unless somebody else wants to jump in, there's a very interesting observation. I guess swimming pools are humid places, but I think the chlorine can be quite irritating to the airways, causing bronchiectasis. I think there is probably not enough data, and I would probably want to have more information to know whether other exposure could have contributed. So I'm not saying it's impossible, and I think it's an interesting observation.
Okay.
I don't see many other questions. I was thinking about a comment that I wanted to make when we talked about ventilation that has been mentioned by a couple of people to improve air quality indoors through ventilation. And I think one of the things that I would like to mention is that you may want to consider, if you live to a busy road, for instance, that you open a window that's not facing the road, if possible, to not get the air pollution from the road into your home. And you may also want to think about the time of the day. If you only can open windows facing the road, that you do it outside of rush hour traffic at periods where air quality is on average better. Aidan?
This reminds me of a study I read a few years ago where folks looked at an office block where they had a ventilation system, and it was turned off at night and only ran during the day when the building was warmed up by people's body heat. And the effect of this was that it brought in pollution from the busy road outside at rush hour, just as everybody came into the building. But when the air was cleaner at night and there was less traffic, it was turned off, and they lost the opportunity to push the pollution back out. So thinking about what's going on outside and what pollution activities are happening outside and when, I think is a really important issue. And coming back to the Greenpeace message, I guess, is that we need to be looking at ways to remove all of these sources of pollution across our society so that individuals don't have to make these difficult decisions about when they can or can't open their windows.
Thank you.
If I I just wanted to comment on that, because I think that's also shown very nicely in the study that I showed from the indoor versus the outdoor air pollution, that they looked at the working hours and the non-working hours, but then the relation between outdoor and indoor is still the same outside of the working hours, just because of that, because the ventilation is then shut down, and there's no use of actually the fact that you can then also renew the air that's inside of the offices. So I think it's also a way of using the ventilation systems that we have in place in a more smart way. I totally agree with Aidan.
Thanks. We are nearing the end of this morning's session, so I'd like to thank you all speakers again for the excellent talks, and the audience for being involved by asking questions. And I guess Phil will send you off into the lunch break.
Yes, so thank you very much again. Thank you from me as well. I've learned a lot this morning. I thought I knew a lot already, but I've learned a lot of new stuff that's really interesting. We're going to have a lunch break of 30 minutes or so, or a coffee break for those of us whom it might be a bit early for lunch. But before we do that, I'd really like to thank Ulrika for being co-chair of this morning's session. It's been really good doing this with you, Ulrika, and I hope to see you again soon. And this afternoon, we're going to be joined by Barbara. We do need to start on time in the afternoon. We're due to come back at 12:45 Central European time. And reason for that is because our first speaker is actually a clinician who's probably taking time out from his clinic in order to do this. And so we don't want to add to the NHS waiting list by making him late. So have a good lunch, stroke coffee, stroke cake, whatever you're going to do. And we'll see you at 12:45 or 11:45 British time. Thank you. Okay, welcome back, everybody. Hope you had a good lunch, stroke coffee break, stroke walk around the block, or whatever you did in the 40 minutes. Before we start the afternoon session, a bit of housekeeping. For those who are joining us for the first time today, please take a look at the chat where you'll find translation details if you prefer to have kind of a live translation of what we're saying, because the whole session is going to be in English. So before I start the afternoon session, I'd like to welcome my co-host for the afternoon, Professor Barbara Hoffman. Barbara, it's great to have you here. Thank you for joining us. Would you like to say a few words to introduce yourself?
Sure, thank you, Phil, and very much welcome from my side as well. My name is Barbara Hoffman. By training, I'm a medical doctor and an epidemiologist, and I work as a professor of environmental epidemiology at the University of Düsseldorf in Germany. I've been very much engaged also in professional societies, so I've been working in the International Society of Environmental Epidemiologists, where I founded the European chapter. And I've also been very much engaged in the European Respiratory Society. Currently, I chair the Advocacy Council there. Now we're going to talk about, of course, why clean air is so important. And specifically this afternoon, we're going to talk about what can you do as patients, what's in your hands, how can you engage so that clean air is actually reachable for you, or that the effects of bad air, of air pollution, will be less harmful to you. Unfortunately, it's not always in your own power to control the level of air pollution. And this is why we, of course, need European legislation to reduce air pollution. But there are a few things that you can do yourself. And this is what we're going to focus on this afternoon: how to interact with your physician, and also how to avoid specific types of air pollution that's actually in your hands, where you can actually do something about it. Yeah, and with that, I'll hand over to Phil again to introduce our first speaker this afternoon.
Thanks, Barbara. So to open this session, we're going to hear from Dr. Robin Gore on how to talk to your consultant, as well as on some symptom mitigation. We realise this is going to be a popular area for our audience today, so we're going to go straight to questions after Robin's talk, rather than wait till we've had a few people and have a question session afterwards. Robin is a consultant respiratory physician at Addenbrooke's Hospital in Cambridge University Hospital's NHS Trust. His main specialist clinical interest is in severe asthma and allergic airways disease, but he also has research interests in local clinical trials delivery and in aeroallergen exposure. Robin, over to you.
Many thanks, and thanks to Catherine also for moving the slides on. First slide, please. Can you see it?
It's coming. There we go.
So we're about to start from the beginning. Okay. Lovely. Okay. So thank you, Phil, and thank you, Dr. Hoffman, for the nice introduction. I have no conflicts of interest of relevance to this presentation. Just one other shout out. I do also represent the British Society for Allergy and Clinical Immunology. I'm their current president, and I mention that because the BSACI is heavily involved with multiple partners in the United Kingdom now for improving both allergy care and helping to lobby for changes in clean air legislation. So there's clearly a lot of interest in this talk. In this topic, I'm going to really talk to you today about from the position of a respiratory physician who has a lot of conversations every week over many years with many of you with patients with severe asthma. We're going to touch on allergen avoidance first of all. We're also going to touch on mold and what you can do, and finally on more traditional forms of pollution. You can see here on this opening diagram, we've got on the left-hand side, we've got the fluorescence picture of Aspergillus, one of the most common indoor molds. We've got some pictures of some black mold in a very moldy home. We've clearly got some traffic-related air pollution that you can see in the middle. And then we've got another random allergen, cockroach, which of course is highly associated with poor housing and poverty, but other allergens are available. So can we move on, please? This is a brief outline of the talk, and we'll move straight on. Thank you. So I want to say, first of all, I've been asked to talk about how to talk to your consultant, which is actually a really nice topic, because normally doctors are spoken to about how to talk to the patient, but we're turning it around, and I think that's a really great way of looking at it. And my reflections are that when I see a patient with severe asthma, often the basics aren't right. And so we've got to get the basics right alongside talking about environmental concerns. And so when you are coming to a consultation, and there's a lot to do in a consultation, is the diagnosis right? Is the therapy right? what's the severity of the disease, and then we can move on to environmental concerns. There's a lot to do, usually in a very short space of time. And so it really is helpful, I think, if you've got an idea of the basics. Have you got your asthma management plan? Is your inhaler technique up to date? Do you know which treatments you're on? And I'm sure many of you in the audience will know that very well, but for many patients, they don't know which inhalers they're taking or which therapies they're taking. They often don't know the names, and they're often not using them regularly. And finally, do you know what to do in an asthma emergency? So we've got to get all that right. And I'm assuming that that is all correct, but it's really important. And then let's move on to environmental concerns. Have a think about what are the asthma triggers that you think are relevant to you. Do these triggers only affect the chest? Do they also affect other systems, your eyes and your nose? What is your home like? Does it look moldy? Does it smell moldy? Have you got some photographs? Because that can actually help the clinician understand what your home environment is like. And furthermore, have you thought about making any changes to what you do in your daily life or to your home, and what changes are you prepared to make? In my 30 years of being, more than 30 years of being a doctor, I think I've only had 2 people rehome their pets, and we know that that's a very difficult and emotive issue. But what changes are you prepared to do? Or more particularly, also your family. And if you've got people in the home who are smoking, what can be done about that? So there's lots of things I think to think about before you come to the consultation, which can help optimize the time that you have with the doctor, with the healthcare professional. Next slide, please. So firstly about allergen exposure, and I think allergen exposure, and we're talking about house dust mites, pet allergens, pollens, fungi, allergenic fungi. There's been a lot of research on how we tackle allergen exposure over the last years, and this is a field which is as complicated and confusing as the field of PM10 and NO2 and the other forms of air pollution. But there are some basic things we can say. Domestic aeroallergen exposure is everywhere. It's ubiquitous across indoor dwellings, and it's difficult to avoid. There are some nice studies of patients going up to very high altitude research stations in the Italian and the Swiss Alps to avoid allergens. But for most of us down at on ground level, allergens are everywhere. There are studies, and I'll show you one in a minute, of multiple intervention asthma reduction. I do sometimes have people come to me and say, I've taken off all the carpets, I've changed my pillows, I've got covers on my mattresses, I've got an air filter, the dog's gone. You can do that. And there is some evidence in children that that might help, but it's difficult to sustain. The other thing that we often get asked about are what happens if I buy a HEPA filter vacuum cleaner? Is that going to be useful? So how much reduction and how useful is it if you do one intervention? We've got good evidence for a single intervention, which is mattress coverings reducing asthma attacks on children. In case the mattress is using the correct density fabric, you can reduce house dust mite exposure into the breathing zone in children. And in children with mild and at best moderate asthma, that can have an effect on reducing asthma attacks. So how do we actually take this forward into some practical advice? Next slide, please. So this is just some of the things that people have used before. HEPA filter vacuum cleaners in the bottom right, mattress encasing, which we've spoken about. Dehumidifiers, some patients buy dehumidifiers. The thing on the left in the yellow bottle is acaricides, which are chemicals to kill mites in carpets and soft furnishings, and then reducing soft furnishings in the home. Next slide, please. So I think I was really interested in the talk on gas cookers and the looking at the effect of a single intervention for pollution in the home. And there have been lots of studies in the allergen field looking at the effects of single interventions in the home. Can you reduce house dust mite using X? Can you reduce cat using a vacuum cleaner? But I think one of the difficulties that we have is understanding how much you breathe in over a 24-hour period. And what's the total 24-hour exposome? And even to date for allergens, we don't have a clear idea about this. But a very interesting study, it's quite old now, from Professor Ewan Tovey from Sydney, busted the myth that all house dust mite exposure occurs in the bedroom. And in Australia, they have a very high humidity. They do have much higher levels of house dust mite exposure than we have in Europe, and certainly probably about 10 times what we have in the UK. But they showed quite clearly that a lot of house dust mite exposure occurs outside of the home. And they did this study with some volunteers wearing a breathing apparatus, sampling house dust mite exposure as it occurs on the lapel close to the mouth and the nose, and proved that your in-bed exposure was only about 10% of the total daily. So in other words, I think the main point about this is that I think people worry about making interventions in the home, but there's the whole of the outside to consider as well. And so I think we will be talking about practical advice at the end, and the practical advice is designed to encompass those uncertainties. Okay, next slide, please. This is a study I mentioned, multi-targeted allergen reduction, and in this study from New York, children were randomized to high intensity allergen reduction versus normal standard asthma care. And so in the active intervention arm, pets were removed from the bedrooms. If there was a pet, there was a HEPA filter in place. Mattresses were encased. If there were cockroaches, there were cockroach busting chemicals used, and everything you can name basically to reduce allergen exposure. And they did find a reduction in symptom days with this intervention, but it was incredibly hard to do. And I know very few people that have actually done this in real life in my clinic. Next slide, please. So moving forward, and then moving to a single intervention, and the best evidence is for encasing mattress covers. And there's a number of different studies now of encasing mattresses with mite impermeable coverings, showing that a 50% reduction, a halving of bad asthma exacerbations in children with mild to moderate asthma. And so next slide, please. It doesn't help that many of the guidelines on allergen reduction differ. And so clinicians have to put all that together and decide actually what they think about it. And this is what we think. I think any guideline has to be practical. You have to take into account whether you're allergic. So if you're not allergic to cat and dog, you can have a cat or a dog. But if you are, and if your symptoms are worsened by pet and dog exposure, then there may be a conversation to be had around rehousing your pet. And sadly, just moving the pet out of the bedroom doesn't work because the allergens are very, very airborne and spread very easily. The impermeable bedding is there, and of course, removing other trigger factors such as smoking and parental smoking. Let's move on. Now, mold again is a very complicated area. We've got some nice molds here, and we've got the Aspergillus on the left-hand side at the top, which is the commonest indoor mold. The spores are incredibly small; they're only 2 microns inside, so they are continuously in the air. They're there. They're not seasonal really. They peak in the autumn time, but actually they're there year round, and they're very difficult to avoid. The next one along are Alternaria. These are big club-like spores which occur seasonally, and some patients will be allergic to these. And if you've got asthma that is worse in the Alternaria season, typically early autumn, you may have asthma worsening in late in the summer, early autumn season. Let's move on. So again, mold spores are ubiquitous, both in the indoor and the outdoor air. And the one thing I want to say is that mold is everywhere. And I do see lots of patients who are really terrified about exposure to any mold, but you will have healthy mold in your lungs as well. We know that the lungs are not sterile. There's healthy mold in there too. We don't really understand what makes, a healthy lung mold exposure and what makes a poor, an unhealthy exposure. But we do know that if you live in a damp house with a visible mold, then that is bad for your respiratory conditions. So that we do know. Some people often come to clinic saying, can you test me for mold allergy? Well, we do know that although you can be allergic to some molds, and I've mentioned Aspergillus and Alternaria, many molds don't seem to produce a measurable allergic reaction that you can actually detect on a skin test or a blood test. And the black molds that we see on indoor buildings, indoor building surfaces are examples of that. You can't really test for those, and if you did, you wouldn't necessarily find an allergic test response. But we know that that's bad. So what can we do about it? Next slide, please. So again, we want to know about your houses. Is there water damage? Are they damp? Is there visible mold? And do they smell moldy? And these very simple descriptors have actually been proven to be associated with the development of childhood asthma. So they're clearly clinically relevant. So you don't necessarily have to have a measure of the mold in the air in your house. These simple clinical factors are important, and we want to know about those. Next slide, please. This is a nice diagram for those of you who like buildings, just about how buildings can go wrong, and essentially poorly ventilated, cheap double glazing, poor drainage, leaks, flooding, poor cavity wall insulation. There's a whole host of building factors which are important to consider when somebody's looking at the building that you're living in. Next slide, please. So what can be done? So firstly, this is really of relevance to the UK. I'm sorry, I can't comment on legislation outside of the UK, but this is a story well known to people in the UK. This was a story of this young lad, Awab Ishak, this is all in the public domain, who died of an asthma attack aged 2 after several presentations to the local hospital. And the house that he was living in, which was social housing, the picture is on the left-hand side at the bottom. You can see the terrible black mold on the walls. And this actually led to a coroner's inquiry, and the mold exposure was for the first time registered as a factor in a young person's death from asthma. And it led to the change in the law, such that social housing, and that's housing owned by local government or housing associations, the landlords now have to respond to complaints of damp and mold hazards within certain set time frames. And the government is now also trying to push this similar legislation for private rented housing. This is all available on the UK government website. I'd be interested to know whether there's similar legislation in other countries. Next slide, please. There's a lot of help out there. On the left-hand side is government advice on what to do if your house is mouldy and if you have a private landlord. And also on the right-hand side from Asthma and Lung UK, our UK asthma charity has a very nice website explaining how you can advocate if you have either social or private housing, and how to talk to your landlord and how to get the council involved if you're not getting anywhere. So there's clear guidance there. Next slide, please. No, I don't know how we're doing for time, bit over. So pollution, I'm going to speed up. We've all had lots of discussions today about what pollution is. So how can we best manage the personal exposure? Things to think about when you go to your consultant or your healthcare professional. What's my exposure risk profile at home? Is anybody smoking at home? Do I exercise at peak traffic times? Do I cycle near busy roads? Do I have a wood burner? We've already heard about gas stoves. And what can I do to contribute to reducing pollution at the best of times? Next slide, please. So firstly, the advice on the UK government website makes specific reference to at-risk groups. These are defined as children with asthma, older people, and those with respiratory or cardiovascular conditions. Now, this advice is regularly updated with the best and the most up-to-date research, so it is trustworthy. It may not be as all-encompassing and detailed as you might hear from other sources, but it is safe, practical and implementable. Next slide, please. There's a lot of resource out here. Again, there's the Asthma and Lung UK website on air pollution. There are various government tools which we'll walk through, and these are some references if you need them. And again, this relates to the UK. I don't know how it compares with other countries in Europe, but I'd be interested to see whether there's similar advice out there for patients. Next slide, please. So this is UK government advice on how to reduce long-term exposure to air pollution. Consider taking routes where traffic is less heavy, if possible, especially at busy times of day. I know that's difficult for those of us who have a set starting and finishing time for work. Consider changing your commute if you can to greener spaces. And if you're exercising indoors, make sure the room is well ventilated. Next slide, please. If you live in an urban area, again, walking alongside busy roads, try and avoid that. Try and maintain as much distance as possible from the road's edge, as even a small gap can make a difference. If you can, avoid driving in periods of heavy traffic, and monitor pollution forecasts. Next slide, please. If you live in a rural area, there are different things to consider, including agricultural activities, ploughing fields, fertilizers, and spraying pesticides. Avoid bonfires and burning garden waste. And again, check pollution forecasts. And next slide, please. So this is the UK Government Daily Air Quality Index. And next slide, please. And you can go to this and type in your postcode, and it gives you a 5-day pollution forecast. Now, I did this for Cambridge, which is not a particularly industrial area. It's in the middle of the east of England, but there's quite a lot of traffic around. And this was on Tuesday morning, I think, and the air quality index was low level of pollution. Next slide, please. What the government then does is it gives you a whole lot of health advice tailored to that prediction. This was the advice for low levels of air pollution. So it was, again, basically following your doctor's or nurse's advice and follow your management plan and consider impact of other triggers. But there's one important update here, and a group called COMIAP has recently published some research showing that the effects of pollution on a single day really can drift over to clinical effects on the ensuing 5 to 7 days. And so therefore, if you have got a high pollution level on one day, you really should be keeping an eye on your asthma control for the following week, not just on that day. And I think that's a nice piece of practical advice that the UK government has just implemented. Next slide, please. So for moderate levels of air pollution, again, it's keep an eye on your asthma, use your management plan and so forth, and adapt physically demanding activities, especially if they make your symptoms worse. We'll come to that in a minute. Next slide, please. And then this is sort of days when you have very high levels of air pollution. And again, you should adapt physically demanding activities outdoors, especially if your symptoms get worse, and following your management plan. Now, the question is, what does that actually mean? And I think the government's been looking at this in a bit more detail. The recent Air Quality Information System review from our Department for the Environment, Food and Rural Affairs, DEFRA, has said that blanket advice on avoiding exercise might be counterproductive because we know that there are vast benefits from keeping up exercise. And so health advice should be framed as encouraging activity with adjustments rather than avoiding exercise completely. And so it's a question of how you do that. So can you exercise at times of the day when pollution levels may be a bit lower after the morning rush hour? Can you do it in greener spaces? Is that practically possible? It doesn't tell you how to do it, and it is a little bit woolly, but it does say that you shouldn't have a blanket ban on all exercise. Next slide, please. And then some more general advice on avoiding smoking and vaping, ventilating when cooking. We've already heard about that this morning, using extraction immediately after the period of cooking, avoiding burning on a stove or open fire if you can, checking labels on cleaning products, aiming for products with low emission or low VOC labels. And wood burners, there's really good evidence now that wood burners and the type of fuel used can really affect your indoor air pollution. And the government is moving towards recommending eco-design stoves using ready-to-burn fuels to cut down the use of particularly wet wood burning, which is very bad for indoor particulate exposure. Next slide, please. This is similar advice, general measures, again, trying to move towards non-car use and driving less and drive smarter if you can. switching to a hybrid or electric vehicle if you can afford to do so. And for many people, that'll be a long-term goal. And then the thing about burning. Next slide, please. So I think that's it. So I think what I wanted to do was really say that I think the government advice, it doesn't go into the details such as use this plant or don't use that plant. It doesn't give you specific advice about getting rid of your gas stove straight away, but it does give you advice which I think is implementable and practical and will be regularly updated on a frequent basis to take account of the latest research. I think also what I want you to take away is that these are the things that you can do, but there's no doubt that the programs that are going on at national and regional level in terms of mitigating traffic-related air pollution are also going to have a significant effect long term on the nation's health. And so don't panic if you can't do all of those things. Some things are out with our control, and the governments that we have in place, certainly in the UK and elsewhere, are committed to those. So I hope that's practical advice. Thank you.
Thank you, Robin. A very insightful and interesting presentation. There's a few questions have cropped up. We've got time for a few questions, if that's okay. The first one is from Helen Wood, who's, I think I know what you're going to say to this, but she asked if you could suggest one thing to reduce air pollution in the home, what would it be?
Well, so I'm assuming okay, air pollution. Okay, so if we just take this as meaning, PM, so particulate matter, then obviously the most elementary thing is to ensure that nobody in the house is smoking, because smoking is, of course, the biggest source of indoor particulate matter exposure. There's data, there are studies going on air filtration units in schools in London. I don't think they've reported yet. So I cannot advise using an air filtration unit in the home. And we know that they haven't worked particularly well for air allergen clearance because there are so many other sources of air allergen exposure. And I think the data on how you commute is actually very important. I didn't have time to show it, but I've got a colleague of mine who measures nitric oxide exposure he cycles around Cambridge with a trolley on the back of his bicycle, measuring NO2 exposure. And when a bus goes by, you can see the level of particulate exposure go up. So there's advice on walking away from roads, or as far away from a road as you can go. It's not mumbo jumbo, is actually based on solid exposure evidence, and there is some benefit to that.
Thank you. Another question from Dominique in the Netherlands. Why is there little attention for the choice of furniture and cleaning products? They've been mentioned a couple of times today. How much do they feature, do you think, in the evidence?
Yeah, I must admit, I'm not very clear on the contribution that those make overall to asthma control. And I think that's a difficulty in the same way that it is with the aeroallergen field, understanding the impact of each of these individual components on lung health or asthma control. So I don't understand the individual impacts of those. I think there will be people who are looking for a very practical solution using solid evidence, and I think that's where the governmental advice is good. But there are also people who do want to do the nuclear option of avoiding as much as possible, changing cleaning products and so forth. And I can't advocate that one way or the other because I'm not sure of the impacts of that. But people will choose according to how they feel.
Okay, thank you. There's a couple more now about some of the more intractable problems that you mentioned. Somebody asked, what can we do if our house is damp, has visible mould, we have a chronic lung condition, but we don't have enough funds to fix the problem? So you spoke a little bit about the UK legislation that's trying to address that.
Yeah. So
is there anything anyone can do?
So I mean, there are you can of course wipe and clean surfaces using fungicides, but the problem is that they are a temporary solution because usually damp building is due to poor building quality. There's a leak from the gutter, there's a leaky wall, there's probably some structural problem with the drainage or the roof or water ingress somewhere, and so the wiping walls to get rid of the visible mold is just a temporary fix, really. You need to understand your legal rights, where you live, and in the UK in particular, even private landlords do have a responsibility to ensure that housing is a safe environment for health, and there is legal redress available. But you'll need some help with that, and that's where in the UK groups such as Shelter and Aspen Lung UK give you clear pathways. And in the east of England, we've developed a toolkit to help patients access that help more readily. So I can't comment on what the legislation is in other countries. Yeah, but you've got to fix the building.
Yeah.
Not easy.
Yeah. Thanks, Robin. There's another more overarching question up here. How can we support change in our communities when it can be more expensive, hard to know where to start, or people look at global policymakers and think, what's the point in me not using my car if businesses and governments are still pushing pollution policies? So what is your advice? What can the individuals do to influence public policy?
Yeah, I think it's a fascinating question. And I think this is either a glass half full or a glass half empty moment. I mean, I think if one looks at the brave politicians, and we do have some brave politicians in the UK, people like the Mayor of London, Sir Sadiq Khan, who had a lot of flack for expanding the ultra low emission zone in London, even from his own party members, but he forced it through. And and they've also instigated low traffic neighborhoods where you're not allowed to take your car on at certain times of day, and you've got to get on your bike. So again, a very, very contentious social change. And at the end of the day, he proved that he had the public's backing. And so the opposition politicians were behind on this, and the public have said, we back this. And so he did introduce the expanded ultra low emission zone, and NO2 emissions concentrations in London are now going down. And it will only be a matter of time, I think, before we see that begin to feed into reductions in childhood asthma emissions. So I think I think one's got to be optimistic and do the right thing and be supportive. And I think it is moving in the right direction. We have got large clean air zones now cropping up across the UK because people want them. So I think the naysayers are actually losing the battle here.
Yeah. Okay. So let's hope that it continues as positively as you just. I
hope so.
And I think we have the possibility for one more very quick question, and this very specific. What about electric cars versus combustion engines? Electric cars also emit particles.
Yeah.
What is your take on that?
They do, and I'm sorry, not really qualified to make a full comment on that. I guess what would be really interesting is if we look at countries such as Norway. That I had the luxury of being on holiday in Norway last week, and every second car in the hotel car park was an electric car. It's absolutely astonishing, and I think 90% of electric cars, 90% of new cars in Norway are now electric. I mean, it's astonishing what they've done, and I guess we'll then see some data on the effect that that's had on urban pollution levels. I haven't seen that data. If it exists, I've not seen it, and I guess that will tell us the answer. If anybody on the call, maybe the speaker from Greenpeace might know the answer to that one. I don't know. But you're right. The questioner is right. Of course, there's tire pollution. There are other forms of particular exposure from cars. But I guess we've got to start somewhere.
Yeah. Well, I guess the emissions, the particle emissions from tire and brake wear are rather larger in electric vehicles because they are heavier.
Okay.
And regarding the overall energy emissions, that very much depends on the electric grid in the country.
Okay.
So if you're producing your electricity with coal-fired power plants, it's probably not so much better.
Yes. Okay.
But of course, within the city, it will always improve air pollution because people who live very closely to high traffic will not have the exposure right on the street as much.
That makes a lot of sense, and we absolutely, it's going in the right direction in the UK. We've got rid of a lot of coal now.
Yeah. Phil, I think we're going to move on. That's right.
Yeah, I think that's it.
Yeah.
Yep, I think it's your turn now to introduce the next session.
Yes, let me first say thank you to Robin for this very interesting presentation and discussion. And now let's move over to Anna Borakowska. She is the co-founder and executive director of Polish Smog Alert, which gathers over 60 grassroots air quality initiatives across Poland. She works on air quality improvement policies since 2012, so she has vast amount of experience in all the regulatory issues in Poland and probably also in Europe. Her experience includes regulatory changes and financial programs driving energy transformation, specifically of houses, and this is what we're going to concentrate on now. Once again, the houses and the indoor air pollution. Anna, please, the floor is yours. We're looking forward to your presentation.
Hello, nice to see you, nice to be with you this afternoon. Thank you very much for the invitation. Should I share my presentation? Okay. Just a moment. Okay, yep. Can you see it?
It's coming up. Yes, now we can see it.
Okay, great. So, but something, sorry, just a moment. Okay, yeah. So just a couple of words about my organization, which I have an immense pleasure to be a co-founder and co-leader of. Polish Smog Alert, as the name suggests, is an organization that focuses on air pollution and smog in Poland. And we are an umbrella organization joining over 60 local initiatives that deal with air pollution locally in their villages, towns, and cities. But as an umbrella, we address national level and regional level reforms. And why? Well, Poland is a good country to be fighting smog because, unfortunately, our air quality is very poor, and actually Poland is among the most polluted countries in the EU when it comes to air pollution. And the city where I am now and where I live, Krakow, used to be the most polluted, one of the most polluted cities in the European Union. I don't know if you have visited Krakow. It's in the south of Poland. If not, I strongly recommend that you do so because it's very, very beautiful. So
Anna, can I just quickly interrupt you? Could you maybe try to switch to full screen in your presentation? If it doesn't work, it's not a big deal, but if it's possible, it would be nice.
Yep. Yeah, sure. Sorry for that. Yeah. Okay. Yes. Let me just see. Yeah, it works. Okay. Very good.
Thank you very much.
So yeah, I'm going to talk about solid fuels. By solid fuels, what do we mean by solid fuels? In Poland, it's coal, but in the rest of the European countries, it's usually biomass. So it's biomass, coal, pellet from biomass, logwood, anything, solid that you can burn legally, of course. And in Poland, the burning of solid fuels is the main source of pollution with particulate matter. Actually, the burning of coal and wood in Poland is responsible for 85% of emissions of particulate matter. Why is that so? Because, well, 40% of single family houses still use coal for heating. It used to be 80%, so now it's only 40%, and around 20% still use wood for heating. So as you can imagine, during heating season, we experience a lot of days with very, very heavy smog. So we have been dealing with Polish smog for over a decade. And within that time, we have made quite a lot of research. And when thinking about indoor air quality, we were always wondering what is the impact of this heavy smog on the quality of indoor air. Because when there is a smog episode, authorities will tell you, do not go out, close the windows, and you will be safer. But how safe can you be when there is a lot of smog outside? So this is what we were researching with our friends from the Krakow University of Science and Technology a couple of years back. And we used 2 high-quality PM monitors, one of them outside and one of them inside. And we looked at the daily concentrations during smog episodes. At that time, we really had very, very polluted areas. So the concentration of PM10, for example, in this example, it's actually an example of our office, our old office in the city, in the center of Krakow. And so you can see that the pollution outside was 300 micrograms. So just to put it into a perspective, the norm is 50. And here we have 293, so almost 300, which means that the actual concentration was 6 times over the norm. So how much pollution migrated inside? Half of it, 155. That's the concentration indoor, which means it was 3 times over the norm. So here this migration was really, really big, 50%, because our office was in an old house with old windows, and the windows were not very tight. So this allowed pollution to migrate freely. Another example from a small town of Skała with a lot of houses using coal and wood for heating. Again, you can see that at least 1/3 of the pollution migrates into your house, which is really, really a lot. And here is an example of an hourly peak air pollution episode. It was in the evening, 7 p.m. also in Skała. So you can see that the smog was so heavy that the concentration of PM10 was over 1,000 micrograms. It's really, really bad. Probably something that you had back in London in the great smog of London in 1952. So and then 1/5 of that pollution is in your house, and you inhale it, sleeping, drinking, eating, lying on the couch and watching your favorite movie. You are exposed all the time to air pollution. So of course, what can you do? You can have better windows, definitely, but that won't save you. You can have, an automatic ventilation system with filters. That will definitely help, but it's very expensive, and also you have to have high ceilings to be able to install it. And of course, you can buy air purifiers and at least reduce a certain level of this pollution. But you need to remember that these air purifiers, they're usually effective only in one room. So you would have to have a lot of air purifiers if you have a house with several bedrooms, for example. So yeah, and fireplaces, very, very interesting topic also in terms of indoor air quality, because of course they can be problematic for outdoor air quality, emitting a lot of particulate matter, a lot of air pollution outside of our houses, but actually they have quite big impact on the air pollution inside our houses. We have done several research phases on fireplaces. Here you can see a graph, and sorry if some of it is in Polish, but yeah, it was impossible to translate it, to change it. But I will explain the graph for you. So we looked at in this research, we looked at 4 fireplaces, and we looked at the impact of their use in the living room, so in the place where the fireplace is installed, and we measured air quality over 2 hours from the lighting of fire in the fireplace. So you can see that in 3 cases, air quality was pretty good at the beginning, and then it really went up very, very steeply. So air pollution increased very heavily within 5 minutes. And then you can see that it actually elevated levels take very, very long to go down. So this air pollution, once it's emitted from your fireplace inside your living room, it basically stays with you. So you can see that after 2 hours, these concentrations were around 100 micrograms per cubic meter. Let me remind you, the daily norm for PM10 is 50, so it's twice above the norm if it stayed for the whole day. So this is pretty disturbing. And I think that, when you think about a fireplace, like the general public, the image is very positive, it's renewable energy according to many pieces of legislation. Yeah. And also it gives you this cozy atmosphere. Well, unfortunately, apart from the cozy atmosphere, it may give you very polluted air. So if you have a fireplace, or if you are considering buying one, an really important thing to do is to see if it is a fireplace of proper quality. For example, eco-design fireplaces should be of good quality, but we can see in Poland that unfortunately it happens, and it's not so rare, that these new eco-design fireplaces, they have low emissions only on the paper. When you buy them and put them to real life tests, they do not perform so well. So you have to bear that in mind. Here is another fireplace that we tested. And again, air quality from dobry, in Polish means good, went to bardzo zły. So in Polish it means very, very poor, over half an hour. Yeah, so 250 micrograms per cubic meter. That's a really, really big, high concentration. And here is an example of a coal burner, coal stove. This is an example from a social housing in Warsaw, where this housing is for low-income groups. And they used to have these coal burners to keep them warm. So in each room, they would have such a burner. So you can see this is the concentration, the daily concentration. So you can directly compare it with the daily standard of 50 micrograms. So you can see that the people were living in something that was really, really polluted air. And if you had this outside, and measured, we would have, like a state of emergency. Whereas these people are inhaling this heavily polluted air and probably even don't know about it. And the last example, this is very interesting. It's also from the research done with Krakow University of Science and Technology, where we compared indoor and outdoor air pollution. Outdoor air pollution at that time was pretty low, and air quality was good. This is the blue line, whereas with indoor air pollution, it was also low until the fireplace was started. And you can see that from 20 micrograms, air pollution went up to 450, and stayed there for several hours, so stayed on a high level. So yeah, you can see that there is a huge problem connected with biomass burning and its impact on air pollution outdoors and indoors. But despite this, not many people realize that wood burning is such a problem. In Poland, air pollution is in people's minds is connected with coal burning, and only 22% of people living in Poland recognize that wood burning pollutes the air. So there is a huge information gap here. And also a lot of money invested by the producers of fireplaces to kind of cultivate this this positive image of wood burning. So to finish off my presentation, just a couple of words on what we do as Polish Smog Alert to address this problem of air pollution from coal and wood burning. So one of our first successes was to ban the sales of, we call them smokers. So these are, because they emit a lot of smoke. So these are a very primitive coal and wood boilers. They were very cheap, and also a lot of people in Poland have free wood because we have a lot of private forests, and also coal was very cheap because we have a lot of coal mines. So, you know, this was the cheapest types of heating, and 150,000 of such very polluting boilers used to be sold every year to Polish households. Now it's banned. So if you want to burn coal or wood, you need to buy an eco-design boiler, which of course has much lower emissions, but still emits quite a lot, and in real life conditions more than they should. We also have regional bans on using smokers. So it's not only that you cannot buy such a smoker, but also you should not use it. Those bans came into force already. You can see the dates when. But of course, we have problems with enforcement of legislation. One thing is to have it written on the paper, another is to have it enacted in reality. And a very important thing, a subsidy program, giving subsidies to cleaner heating or clean heating. It's heat pumps and eco-design biomass boilers, but also for energy efficiency, so that the cost of heating does not go up, and you have an efficient house with good ventilation, which, for example, is a good solution for mold as well. Already this program has helped 1 million houses, so that's pretty impressive. And just to finish my talk, just a couple of words about Krakow, because I believe it's a very special place. As I told you, Krakow used to be the most polluted city, one of the most polluted cities in the European Union. We used to have 140 or 150 smog days per year. So more than 1/3 of the year, we would breathe really, really heavy smog. Now it's down to around 20 days per year. So how did we? You can see here Krakow shrouded with this smoggy blanket. How did we do it? Basically, Krakow banned the use of coal and wood whatsoever in the whole city for domestic purposes. So you cannot have a fireplace in Krakow. That's possible. And we've introduced that in 2019. And the city invested, actually it was state money, but anyway, the city invested 100 million euro to help people get rid of their coal and wood heating and install cleaner heating. 45,000 coal and wood stoves were eliminated. And as I said, air quality has improved greatly. But what is really, for me, like a really nice story is that we can also see studies showing that the health of people living in Krakow improved. And this is my favorite one. Because it's about children. So these are, children, they cannot fight for their own rights. We need to do this for them. And before the ban, when we had this really polluted air, almost 1/4 of Krakow's children suffered from asthma symptoms. Krakow school children, 22%. And this fell with air quality improvement to 9%. now probably it's even less because the research stopped a couple of years ago. So, but the air has been improving still. So that's really something positive, I would say, and showing also that policies can guarantee cleaner health and can guarantee healthier society. Thank you.
Thank you very much, Anna. This was very impressive, and congratulations. And there's a lot of congratulations to your great work and success in the chat. So this is vastly appreciated. I think we're going to move over relatively quickly to the next speaker, but I just a very few quick remarks. Those people who can not afford yet to change to a heat pump or a cleaner heating, do you have any advice for them what they can do to limit all the exposure that they will receive from their smoker at home?
Well, of course, what has already been said, if you use wood, it should be seasoned wood. At least in Poland, we have this rule of 2 years of seasoning, right? So the humidity of wood should be less than 20%. That's one thing. Another thing is that, of course, if there is a strong smoke episode outside of your house, then of course avoid, I don't know, running or exercising outside, close the windows, but we could see that it's only a partial solution. And if we want to have clean air inside our houses, well, we have to have clean air outside of them as well. So this is, of course, there are a lot of people who are struggling financially. So this is why we are trying to convince the government that the most important thing is to help them financially to go through this energy transformation of their houses, to insulate their houses. Of course, in Poland, we have quite harsh winters. So you need to have good, well-insulated house. You need to have an efficient source of heating, because these smokers, they are not only polluting, but they are also inefficient. So you need to use much more coal or wood to have the same energy effect. So, but yeah, financial programs, we believe this is the heart of the anti-smog policy.
Yeah. And this is already a very good a transition to our next speaker, and I'll hand over to Phil to introduce our next speaker. Thank you so much, Anna. Yeah. This was absolutely interesting.
Thank you, Anna. It's great to hear from both you and from Robin earlier about good examples of how policymakers can take the courage in their hands and make a difference. So now we're going to have a presentation from Thomas de Jong from the European Public Health Alliance on how policy can improve our health at home generally too. Thomas is a policy manager where he leads work on health equity and the social determinants of health. When it comes to indoor air pollution, his work has covered how energy poverty and housing conditions impact our health and also health inequities, including respiratory, cardiovascular, and mental health. Thomas, over to you.
Perfect. Thanks a lot, Phil and Barbara. And of course, also a big thanks from IFA's side for the invitation to speak here today. I've really enjoyed the presentations up until this point quite a lot already, and I'm also very happy to report, while I'm sharing my screen, by the way, very happy to say that a lot of the things that have been talked about almost seamlessly cover over into what I will be speaking about today. Just to briefly introduce it, I will be speaking about what are the policy levers, what can we do to drive good indoor air quality. So I'll be focusing on indoor air quality from the policy perspective. I hope everyone can hear me okay and see the slides. Before I get into the topic at hand, maybe just a quick introduction on the organization I work for. So we're the European Public Health Alliance, or IFA for short, and we're a membership organization. We're based in Brussels. We're a change agent for better public health in Europe. We focus really on good public health for everyone in Europe, no matter their background or their needs. We do so through advocacy. We represent over 40 members currently in over 20 countries in the WHO European region. So that focuses not only on the European Union, it also covers the wider European region as defined by the WHO. And then maybe just a quick context around what kind of members we represent. You can really think about public health, civil society organizations, umbrella organizations such as ERS, but also organizations that represent cancer interests or liver disease, diabetes, and so on and so forth. That includes patient and disease groups essentially. But also health professionals, so doctors, nurses in different capacities. And lastly, also organizations that operate more locally, kind of similarly, I suppose, to what Anna's organization also does. So more grassroots, maybe running projects on health literacy or these kinds of examples. So that hopefully gives you a little bit of a perspective on the background. Now, as I said, we advocate for better health. We do so mainly by bringing together the various stakeholders in the EU bubble, in the EU policy space. And in doing so, also very much focus on legislative action, so on policy, creating those living environments in which people can flourish in good health, realize their right to health, live in good well-being. And what is important also to mention is that we do so through addressing the determinants of health, the various determinants, so social determinants, political, commercial, environmental, which is very important and relates to what I'm going to be talking about today, so which is indoor air quality. Now, I think I'll be preaching to the choir when I say here that obviously indoor air quality is an extremely important thing to talk about. It's a core environmental determinant of many different kinds of health. At the same time, I'm sure it's also no mystery to you that it is often overlooked. It's something that is somewhat of a regulatory blind spot, let's say, which is remarkable given the fact that, which has also already been mentioned today, 90%, i.e. 9 out of 10 breaths in Europe are taken indoors. We have numbers on this. What is even more remarkable in relation to that is that even though we spend so much time inside, the regulation around indoor air quality is, when you compare it to outdoor air quality, a bit inconsistent. We have quite consistent regulation around outdoor air, but less so around indoor air, which is problematic given its massive impact and the fact that we spend so much time indoors. What is the good news in that respect, though, is that there are levers, there are policy levers that we can use. And this is also relevant to the people in the room here today, of course, because there are ways in which we can work with what we have and perhaps build even better structures around it to improve indoor air quality and mitigate the effects of that on our health. I will be taking you through that by explaining a little bit about what is already there, what we can improve, and how we've been trying to do so as well. Now, as I said, there are more consistent systems in place for outdoor air quality. We have frameworks in place that allow us to do monitoring of air pollution outside. We have ways of doing reporting on that. There's research going on this. And there's also, to some degree, legal accountability frameworks in place. So there are ways in which we can also drive action by going through the legal path. As I said, the same thing does not necessarily apply to indoor air quality. But we do have some levers in place that can be used already to some degree. So there are two in particular that I'm highlighting: the Ambient Air Quality Directive, AAQD. I will try to keep the abbreviations to a minimum. And the Energy Performance of Buildings Directive, or EPBD. Why these two are in particular important to mention here is, well, when it comes to the first one, the Ambient Air Quality Directive, what this already provides us with is at least concentration limits on certain pollutants. And this already brings us closer to WHO guidelines on those concentrations. And that is, of course, important when you talk about outdoor air pollution. It's not necessarily the same case for indoor air pollution yet in terms of its recognition, but it is a baseline that we can work from. And then when it comes to the Energy Performance of Buildings Directive, what is important here is that it makes explicit mention of indoor environmental quality. So not necessarily air pollution as such or air quality, but at least environmental quality inside. And it also has very strong hooks for topics around ventilation and around air quality, at least in some of the themes that it covers. Having that in place, though, we still are left with two core issues in particular. First of all, it relates kind of to what I was already saying around frameworks, right? We have currently a lack of harmonized EU standards for indoor pollutants. which means that, as I said before, there's not really any type of systemic monitoring going on or accountability mechanisms in place to ensure protection for indoor air quality. But even so, there is currently the Ambient Air Quality Directive and the European Performance of Buildings Directives is being transposed nationally this year. So that means that we do have ways to act on it. But the problem there is that because there's no harmonization, the implementation thereof is different across different member states, where the actions that take place in Poland may be very different from the ones that take place in my native Netherlands, for example. Another large issue, which will also likely not be unfamiliar to you, is the dilution of the commitments. So in the existing legislation, there may be certain goals set, but we face risks of those being diluted because of simplification or deregulation waves. We know that this is already taking place currently, for example, for the Ambient Air Quality Directive, where the House Committee in the European Parliament has released a report recently where those standards were being put to question. This has been averted, thankfully, but it does indicate that the goals, the air pollution goals, so to say, are at risk, and that is something that we need to be aware of. The solution that we would push for in this context, I've already kind of alluded to it, is some form of European indoor air quality framework. So something that nicely binds everything together and that allows for a nice structured approach to improving indoor air quality. That includes a couple of aspects. One is to recognize healthy indoor air as a human right, a fundamental human right, rather than a privilege. To ensure within that framework that we create consistency across Europe, that we try to some degree bring member state action closer together, which is in particular important when you're talking about public buildings, because this is where the monitoring and the compliance is most easily done. If you can regulate that consistently across Europe, the effects will be much increased, of course. In relation to that, what such a framework would also allow is less dependency on national discretion. So it would allow us to reduce the differentiated approaches between the member states. And this is in particular very important where previously I was talking about public settings. This is also for private homes very important because there might be less opportunity for measuring there, but there is a possibility there on the European level for source control, so reducing emissions from certain appliances and product standards standardization. Now that's the main premise, right, of talking about, okay, why do we need a framework? The next question then becomes, how do we realize such a framework? Now you can already see a couple of images here on the screen of various ways, publications, inputs on consultations that EVA has provided with its partners to improve topics around air pollution in general. But there are, to stay with the topic that I'm speaking about today regarding the legislation, I'm going to take you through it step by step by providing a little bit more context on some of the specific regulations that I've been speaking about. So, unsurprisingly, based on what I've already said, when we speak about the European Performance of Buildings Directive, what we can push for there, what we really need within that context is to improve the standards to translate indoor environmental quality into very clear and measurable standards on air pollution. That we create monitoring requirements for that level of air pollution, in particular in public buildings, because that's currently the only place where we would have the option to do so. And stronger ventilation obligations. The importance of ventilation has already been mentioned at length today. And again, repeating, to reduce member state discretion in the transposition of the rules set in the EPBD in the so-called national renovation plans, so that we, just to reiterate the point, ensure that there's not uneven protection between member states across the European Union. When we speak about the Ambient Air Quality Directive, what is particularly important here, what we try to push for, how we try to improve it, is by increasingly recognizing the link between outdoor and indoor air pollution. This has also already been mentioned today. We need to align closer with WHO guideline limits on outdoor air pollution, but we also need to recognize why that is important for the indoor air pollution, because as has been extensively mentioned today already, the pollution that takes place outside will make its way into the home as well. and will have equally or at least similarly devastating effects on our health as well. And that's why that link needs to be recognized very clearly. What is crucial to also mention there is that we then need to also keep in mind that we focus on vulnerable groups. So you can be thinking about, of course, people with certain condition, chronic conditions, respiratory conditions, or also on social levels. So, for example, if we're talking about children, schools near traffic corridors, or social housing in polluted zones, it is important that we keep those in mind as well, because those increasingly vulnerable groups also need to be kept in mind. Otherwise, they risk being left behind. And lastly, what is then important here also is to provide a very clear link with the European Performance of Buildings directives, to ensure that when buildings are built, that built environment, that we ensure that there's clear ventilation and filtration built into the system, so that air quality planning is improved, so that those two operate in tandem, so to say. Now, those are two examples that I'm mentioning that have something to do very much with the built environment or the direct environment in which we live. But another thing that is important to and has already also been touched upon today is the applications, the products, the appliances that we use in the home, because we can regulate what happens around us, but we also definitely need to look into how we can do the same for the indoor space. Also because, of course, monitoring is very difficult in private homes. I'm talking about two things around product design in this regard. One of them has already been mentioned by Anna as well. Eco-design, it's essentially what sets the performance requirements for certain devices, appliances that we use in the home. It is currently also relevant because it's being implemented currently through delegated acts on specific appliances. And this is important because here we really need to set clear emission limits. So the pollutants that are emitted from these appliances, that we very clearly regulate how much that can be, and indeed also how they in reality operate. And what is also important to mention there is that it's very helpful, and we should push for also aligning the standards within eco-design to align with climate goals and with health objectives as well. Again, to recognize the impact that indoor air pollution has on health, but also, of course, to see about how it relates to goals around climate change. Another example may be more familiar to you, the energy label, especially those of you who are in the EU. These labels, the efficiency labels from A to G, that we see on products in the European Union in terms of their energy use, their efficiency. Here, there's also very clear goals that we have that we need to push for. One of them being that we remove the classification for biomass, solid fuels, as has been mentioned in the previous presentation. This is in particular important because we need to avoid creating this impression that there are efficient but polluting appliances. There may be appliances that can be efficient but that still emit certain pollutants that have a negative effect on our health. And that is something to keep in mind. Then that's about products. I've spoken about the environment, the built environment, and I've spoken about products. But the other thing to talk about is, may also not be unfamiliar to you, financing and research. It's already been emphasized how important that is. We need to ensure that there is clear investment in the transition, and we need to ensure that we have the evidence to do so effectively. Again, to also underline here that it is very important that we make clear that link between the indoor air quality and its impact on health. And also for that, we have some possibilities in the EU context. One of them is the Social Climate Fund. You see here an image of a report that Eva did on energy poverty, in which we also talk about the Social Climate Fund, about transitions. This is very important when you're talking about vulnerable groups, where we ensure that there is, on the national level, funding in place that allows more vulnerable groups, people from lower socioeconomic status, but also people with chronic conditions, for example, still have the means, the support they need to make the transition to cleaner appliances or improve ventilation in the home, for example. That's a tool that we have and a tool that we should use. And another one that is very important to mention here, again, very sort of service level I'm talking about it here, but Horizon Europe, the EU's main research program. And this can fund projects on indoor air monitoring. It can fund projects on measuring the health impacts of indoor air quality or indoor air pollution. But also, of course, the link to policy translation, to also research how we can actually make the change that we need to improve the quality of air in the indoor space. Now, this may still seem a little bit vague, which is why I wanted to make and give you a case study, an example, something that has also already been mentioned today by Aidan. Gas cooking, something that Aoife has been working on quite a bit as well. And you can see some examples here on how we've done so with various publications, but we've spoken about this at length. And it's a good case study about indoor air quality and ways to improve the policy around it for a number of reasons. It's a good example because research shows that nearly 1/3 of European households still rely on gas cooking. So there's a large degree of gas cooking that still takes place in Europe and that we should address. We know that gas cooking emits, has also already been discussed at length, pollutants like methane, benzene, nitrogen dioxide, and carbon dioxide. We know that indoor air exposure to these pollutants often exceeds WHO guidelines in the indoor space. But what is also useful to illustrate the point here is that gas cooking has a large inequity and energy poverty dimension as well. Energy poverty because low-income households are often more exposed to or have more difficulty accessing cleaner cooking appliances, and as such are also disproportionately exposed to them. This relates to the point also on inequity, because people with a lower income, but also people with chronic conditions, will often be spending more time indoors anyway, for various reasons. For the reason of the condition, for example, will have less capability to find clean cooking devices, and as such will be disproportionately affected because they are both unable to access those devices and also more exposed to them in the indoor space. Now, the recommendations that we've developed to address that reflect very nicely what I've already spoken about and what other speakers have also addressed today. I'll go through this very quickly to not go over time too much. But first of all, the phase out, of course, of gas cooking, which can be done through eco-design and energy labeling that I mentioned before. Of course, from the equity dimension, the financial incentive. So to ensure that, for example, through the Social Climate Fund, we allow the opportunity for people from lower income or people with at a vulnerable status or with chronic conditions have the capability to make the transition to clean cooking devices, but also, for example, to improve ventilation or improve filtration in the indoor space. Third, to communicate has also been mentioned today, to raise awareness about the effects of indoor air pollution caused by cooking hazards and how those hazards sort of relate to our health. To collect data on it, very clear need to get increased research and data on those effects. And of course, lastly, the sort of wrapping up conclusion, to harmonize this in an EU framework for indoor air quality. And that brings me to the final point I wanted to bring to the table today, which is the so-called Healthy Indoor Air Global Pledge. This is an example of something that Aoife was involved in that drives, we believe at least, is a first step towards real change. For context, this is something that Aoife was involved in the September 2025 UNGA, United Nations General Assembly in New York. You see an image there of our Director General, Milka Sokolovic, signing that Global Pledge for Healthy Indoor Air. And what is important about this Global Pledge is that, as I mentioned before in my presentation, it addresses that need for recognizing healthy indoor air as a fundamental human right, not as a privilege. The pledge is global, as the name implies. It focuses very much on creating legal tools. It calls for legal tools so we can also really drive that accountability mechanism. And it's the first of its kind, which is important to note. It's the first kind of global pledge that focuses on healthy indoor air. It's supported by even some governments, which is promising to see. And it allows an opportunity for Europe to be a global trendsetter, so to really be the vanguard in driving the importance of healthy indoor air quality. Within the pledge, you will find a focus on source control, so reducing emissions, of course, and it also includes that focus on ventilation and filtration. And that's very encouraging to see something like that recognized also at the member state level. So to conclude, we have a legislative window in the European Union, at least. We have the capabilities and the will to take those first steps to improve also indoor air quality in relation to outdoor air quality. I wanted to conclude with reiterating those main points, that it is very important we approach it from healthy air as a human right. Whether that is outdoor or indoors is then somewhat irrelevant. We need to push for that in general. It is very important to align that with what I've spoken about with policy, but also with the science and investment that I've discussed, and a lot of the work that has been discussed also in the conference today from the patient perspective, research perspective. And that is really the main message, to do it together, to work together. I think the point on the agenda after me will also go into this, the working group, of course. That's what I would really like to emphasize there, that it's something that we all need to cooperate on. We as IFA also definitely need that help from the researchers, from the people who have the patient testimonies. That's the main message there. I'll conclude it there. I've got my contact information there on the slide as well. Happy to have a discussion with all of you about further details, of course. But with that, I'll hand it over back to Barbara and Phil. Thank you very much.
Thank you, Thomas. Very interesting and informative presentation there. One thing that struck me through the whole day was how much synergy there is between the researchers, the clinicians, the patients, and public health, all speaking with the same kind of voice, basically, which gives you hope that something might be able to change for the better. Barbara, I'm not seeing any new questions in the
No, there aren't any new questions
If
here.
anybody wants to put any questions on there, then please do so. But I'd invite the people who have just been speaking this afternoon maybe to put their own reflections on what Thomas has just talked about. Robin's had to leave, unfortunately, but Anna, is there anything you wanted to kind of add to or reflect on?
Yes, maybe one point, because I know there has been a lot of talk about the impact of gas cookers on air quality and the emissions of gas cooking on NO2 concentrations indoor. And I don't find the same kind of momentum for fireplaces and PMs. And I was wondering why, basically.
That is a very good question. I don't think I have an extremely satisfactory answer to that question. What I can tell you is that in the way in which we as IFA have sort of moved into this space, right, on gas cooking, has been a very gradual process. So, you start from the perspective of air pollution, for example. Then you go one layer deeper. In our case, okay, what's the impact of that on health? Then you go one layer deeper, and we get to, for us, it was already very difficult to sort of get that space as a health actor within discussions around some of the legislation that I've been speaking about. And I could imagine that a similar approach is that it's essentially a layer deeper, that we're talking about gas cooking. Then we can start talking about wood burning stoves. We can talk about the different kinds of fireplaces in use. It's really sort of a layered, it's a stairway, if you will. But that said, it is also definitely something that we've spoken about as an organization. We also address these different types of solid fuels that you've discussed in your presentation as important. But indeed, maybe the momentum on that is not as strong yet on some of the other topics.
Yeah, it's not that gas cookers are not important. It's not what I'm implying, but yeah, okay, thanks.
Fully agreed.
Thanks, everybody. I think probably we need to move on. I noticed some people are having to leave the seminar. We want to go on to the last session before we're left in an empty room. But thank you again, Robin, and who's not here, and Thomas and Anna for your presentations this afternoon. we're going to move on for the last session to introduce the ELF patient working group on climate change and air pollution, which is kind of like our commercial break. And Thomas talked about a call fraction for politicians and policymakers. This, in a sense, is a bit of a call fraction for those of us on the seminar who are interested and want to know how to get more involved on a kind of a personal level. And I'm going to ask Catherine to explain a little bit more about it.
Hi, Phil, and thank you. So on our screen right now, you can see some of the great members of our working group. And I think it's really important to acknowledge their efforts behind the event that we've had today. So the working group have come together because they all have a shared interest in air pollution and climate change. And they help to drive quite a few of the activities that are delivered from the ELF, including deciding on the themes and topics of this event today, and looking at some of the speakers and some of the and engaging people for us as well. Also important to mention that Phil is also a member of this working group, so he himself has been helping to coordinate and recruit speakers for today. But what's really great is that not only do we do the event, but we also get to feed into some of the projects that ELF and ERS are involved in. And we also get to look at or be involved in some of the research and get the patient perspective in as well. So there's just a couple of projects that I thought we could touch on today just to illustrate that, one of which you've already heard about from some of our morning speakers. So that's the Welcome Project. So we have the ERS CRC who are involved quite heavily in this, and we won €2 million to deliver a research project on the impact of indoor air pollution on health, and that will be run with Errol and Agnes. But we will be looking for patient involvement. So one of the ways that you can be involved in this, as well as through the QR code that was shared earlier on, is by joining the working group itself, and then you can come to all of the meetings we have and really be quite integral in that research project. Another is Nexus. Now it's really interesting to me that a few people mentioned non-exhaust emissions this afternoon. This project is completely about looking at non-exhaust emissions. It's definitely an emerging area that is getting more and more attention, and the Nexus project, of which we are a part of, has been set up to start to look at what it is that people know, and what we don't know. Do patients understand it? Do the public understand it? And it's a partnership of universities and public organisations across Europe. So again, by joining the working group, this is something that you can be involved in, and it will be going on for 5 years. So it's quite a long period that you can actually impact the direction of this project, and the outcomes of which will be to advise on missing research or missing policy, and really help try and change the European landscape on non-exhaust emissions. So these are quite big projects, but we also have consultations time to time. We also get to work on things like the Healthy Lungs for Life campaign, which we run, and things around the ERS Congress. So if you're a patient and you're interested in joining, my details should be in the chat now for you. Please just email me, let me know that you want to be a part of it, and I will make sure you get an invitation to the next meetings. I will say for now, it's closed to anyone who doesn't have a lung condition. We have a really nice group, but not many patients at the moment. So we want to build that side of it up. If you're a professional, I think there are other avenues that you can explore, and maybe get in touch with ERS. And if you're a patient org, then we're always happy to work closely with you. But right now, we'd rather you disseminate this to your networks and encourage more patients to join this group. I think some of our group are also here, so I don't think they've said hello in the chat. I tried to invite them to become panelists, but I'm not sure that they were quite so keen today to appear on screen alongside us. But it's not just me and Phil. There are several of us, and they're quite busy meetings, often sort of 8, 9, 10 of us. And Shane, yeah, thank you, Shane. Nice to see that you're here as well. But yeah, I think that's it. Unless there are any questions, I'll hand it back over to you, Phil and Barbara.
Thank you, Catherine. I can just looking at the chat, what people can see for themselves. There are some members of the group who are going in there saying hello and saying it is certainly worthwhile getting involved. It does help make a difference, and it kind of makes us feel like we're doing something as well, even if it might be in our own little small way. But it's better than doing nothing. It's a worthwhile thing to get involved in. So thank you. I think we're probably done now for the formal bit. I think I'll hand over to Barbara to do the wrapping up and what happens next.
Yeah, well, thank you, Phil. Yeah, it's my privilege now to wrap up this afternoon session and give you some information on what goes on and how to keep in touch. So, but first of all, just looking at what we heard about this afternoon, we had these 3 great presentations. The first one from Robin about what to discuss with your doctor when you're coming in. What should you think about beforehand, what to bring in, what kind of questions to bring up when you're talking to your doctor. Even what I found interesting, bring photographs of your house if you have any specific questions. And then following that, we heard a lot of very practical advice to reduce exposure in your home, with the most evidence being available for encasing mattresses. But also there were quite a few other interesting measures that he talked about that is quite important, specifically if you have a respiratory disease. So lots of things to think about. One big thing that was addressed by Anna was fireplaces in the home as one big outstanding source of indoor particulate matter exposure. We heard quite interesting things about the relationship between outdoor and indoor air pollution, and how also outdoor air pollution comes in and then indoor air pollution adds to this. And this directly led to our last speaker, what can we do about it? And we heard quite a bit on how to tackle indoor air quality on a political level, so that protection within the EU is even, and we don't have people that are left out of protective measures just because they happen to live in a country that doesn't care so much about indoor air quality. What I found quite interesting, he stressed the necessity of clean outdoor air because it's an important determinant of indoor air, and about the harmonized indoor air quality standards, but also the financial frameworks that are necessary to ensure that there's funding for the transition available to everybody, and also specifically for the most vulnerable people. And maybe even most important, he called for clean air as a human right, which I think is something that we can all very much support. And finally, we heard about the patient working group on climate change and air pollution that gives everybody the chance to really get involved and further political and societal change on this really important question and topic. So now I think I'm left to close this up by saying thank you to many people who made this happen. First of all, huge thanks to all of our speakers and patient contributors, the members of the event working group who helped to plan it, and everybody who helped to promote the event. And of course, to all of you engaging with questions and into the discussion, which really made a super interesting day for everybody, I hope. There are ways to keep in touch, and you can see that on the screen right now. If you have enjoyed today's event and would like to hear about future European Lung Foundation events, just sign up to the ELF newsletter or follow us on social media. The recording will be available on the ELF YouTube channel as soon as possible. And if you have registered, you'll get an automatic email when it's available. Finally, there's a short survey. I guess this is the one. Catherine, please help me. This is the one.
Yes, that's right. I put it up already because I could see people.
Yeah, that's already up. You can already see it. It's really important. If you have a minute, please take that short survey. It helps us improve future events. And I'd also love to know now what everyone's favorite part of today has been, so we can have this quick poll from you, which we will use for further planning. And I think now I'll hand over to Catherine for finalizing and closing the event.
Yeah, that's brilliant. Thank you so much to our chairs, Barbara and Phil, and also to Ulrike, who was here this morning. You've done an excellent job. We've done so well that even though sometimes it looked like we might go over, we are in fact finishing slightly early, which is wonderful. So thank you to everyone who joined us and to speakers as well. And as Barbara's already said, do keep in touch, and we'll see you soon. Thank you, everybody.
Thank you.
Thank you.
Catherine.
Bye-bye.
Bye.